Good morning. We're back. We've got some colleagues joining us now. This is the Joint Education and Culture and Public Safety meeting. I'm Chair Will Jawando. I'm joined by my colleague of the Public Safety Committee, Chair Sidney Katz, and our colleagues on the committees. We have two items on the agenda today. First is a briefing on MCPS attendance and truancy policies and programs to help prevent that. And we'll take that one up first. And the second is a briefing on missing persons from MCPD. Just to tee it up, and then we'll get into the presentations. And I want to invite, I know there's folks from MCPS and the State's Attorney's Office here, so we'll have you introduce yourselves momentarily. I've been doing a tour of all of our clusters, and absenteeism is something that has been a theme. And I know Councilmember Katz has been with me on some of the tours in his district, and so have other council members. It's an issue nationwide. We are not alone. Just like normally we reflect the country because we're so diverse and large, but it's a significant issue, as I know we'll see borne out in the data. And coming out of the pandemic, it's been a challenge. I've heard from, when I go to these schools, I ask administrators, I ask educators, parents, students themselves. Absenteeism is one of the top issues that comes up from every group and the impact it has in some schools. And it's felt disparately too. Some places are dealing with it in a different way, so we'll talk about that. It impacts the capacity of educators to teach. And there's a lot of complex layers. We were just talking up here the other day about, you could have the whole council here, you could have every committee just about to talk about this issue, because there's health and human services, there's transportation issues, there's certainly education, public safety. So, but I think we're ready to have a good discussion about it today. And really appreciate all of our partners from all the agencies that are here. This is something that we want to be supportive of with the council and make sure that we understand what we're doing collectively to reduce these numbers. So I'll turn to Councilmember Katz, and then we'll get into the presentation.
Well, thank you, Councilmember. I appreciate that. I, first off, as always, like to thank the people doing this work. Steve Neff is sitting there. And my wife was a people personnel worker for Montgomery County Public Schools for a mere 20 years. She was a speech and language person for 20 years prior to that. And Steve was her boss. My wife did not have a boss at home, I can tell you, Steve. But anyhow, Steve was her supervisor. Let's put it that way. And this is not a new problem. This is probably a problem that has gotten worse over time for a variety of reasons. But this is something that is necessary to have the discussions and figure out what we do and what we don't have and the resources that are needed. The second topic is really something, as Councilmember Jawando mentioned, is really for missing persons. There is some overlap on this, but not as much, thank goodness, in many ways. So we need to work through it. And I do see the state's attorney here, if I can invite him to also come to the table. John McCarthy is here, and he and others have come up with a truancy review board and other issues so that we can work on it from all sides in every way we can. And with that, I'm going to turn it back over to you. Thank you.
Absolutely. I was trying to let you off the hook, John, so I know you have your staff here.
No, never let him off the hook. Don't do that.
Well, thank you very much, Chair Katz. And so we have two presentations, and we'll take them collectively. We'll do MCPS first, and then we'll do the State's Attorney's presentation, then we'll ask questions on both. So if colleagues have, just send a text, and we'll get into it. And if there's anything I missed, Ms. McGuire, do you want to mention what's in the packet briefly?
Thank you. I just would mention both the Montgomery County Public Schools representatives and the Office of the State's Attorney sent significant information for this briefing that is in your packet. And this is an area of longstanding partnership between these two agencies. This is an area where, again, you'll hear there's been a great deal of work over many years really to convene the folks that you see here, as well as a true interdepartmental, interagency effort to really support students and families from a variety of perspectives and to try to address and remove those obstacles and barriers. What we're seeing in MCPS, MCPS did provide absenteeism data related to chronic absenteeism. And the rate so far this year, while it is still higher than pre-pandemic levels, it is lower than last year's levels, and so certainly indicates positive movement there. And I would just note that many of the trends and patterns that are reported in the data mirror that general flow. High schools, of course, have higher rates than, I shouldn't say of course, but they have higher rates than other levels of school. So at any rate, we can, again, I just wanted to highlight the information that's here regarding the programs, and we can turn to the presentations.
Great, thank you. Mr. Montanaro.
Thank you, Chairman Jawando, and good morning, council members. As always, we're grateful for the opportunity to engage in this collaborative conversation around the work that we're doing. And indeed, this is collaborative, right? And a lot of the topics that it seems that I come before you are impacted by some social determinants, some societal determinants, as we've heard. Just this first slide here indicates the attendance campaign that MCPS has undertaken, starting with Dr. Midnight's press conference back in August, and there's a multimedia campaign, All Together Now, In School Together, Learn Together, and Achieve Together. Most recent PSA went out in Thursday's Thing to Know, and what this campaign really is about is that it takes all of us, parents, students, central office, administration, wellness professionals, as we've talked about quite often, teachers, and certainly outside partners, right, some of whom are with us here today, because we know that it is not something that we can control solely in schools. And so our focus really with our staff and our administration has been focus on what you can control. Let's not talk about all the reasons why it's a problem. Let's focus on what is within our control. Next slide, please. So in the spirit of collaboration, we always like to root our work in our shared values. And for this one, relationships are key and partnerships are key. And earning the trust of our community and earning the trust of segments and parts of our community, student populations and individual parents is key. In order for us to understand the root causes of why some students are unable to come to school or the issues that families are struggling with, they must trust us to communicate those to us. So that is a fundamental building block here. Beyond this, our partnerships with our school administration, our staff, as well as our county and our community entities are at the foundation of this work, and you will hear more about all of those as we speak with you today. Slide 3, please. Next slide. So before we begin, I think it is important to always differentiate between truancy and chronic absenteeism. These are often used interchangeably. And so it's important to really focus on what we are focused on, and that is students who are chronically absent. So a student is chronically absent if they miss 10% or more of the days that they are enrolled, regardless of reason. And that is significant. This is not just unexcused absences, but these are the students who may be sick, may not be sick. Some parents will write a note, don't worry about it, stay home. Other students may go to school, what have you. And so really, some of the things to think about this, if you are absent 18 days or more, you are chronically absent. If your student is out 2 days a month, doesn't seem like a lot on average over the course of a school year, that student is chronically absent for whatever reason, as opposed to truancy, right, which is 20% or more of the year. And the reason that we focus on chronic absenteeism as opposed to truancy is because this is the data metric used by the state of Maryland. It is the data metric that is used nationally with LEAs across the United States. And so as we focus on this, we are really looking at preventative, problem-solving, and trauma-informed strategies. And again, back to that family engagement. Next slide, please. So as I think Council Chair teed up at the beginning of this presentation, we are not alone in MCPS in combating this. Since the pandemic, chronic absenteeism in the United States has doubled since the pandemic. And most recent data from the U.S. Department of Education indicates that 1/3 of all students in the United States of America are chronically absent. And from our work with Attendance Works, which is a national organization designed to combat chronic absenteeism, their research indicates the following. The first month of a student's attendance can predict poor attendance throughout the year. So 50% of the students who miss 2 to 4 days in September will ultimately miss about a month of school. And that's why we've really focused on real-time monitoring right out of the gate, which you'll hear about soon. And of course, we know that poor attendance leads to a lack of ability to succeed academically. And poor attendance specifically, according to research, can influence whether a student reads proficiently by 3rd grade. That's learning to read versus reading to learn. And that is one of the key metrics of MCPS's pathway, that 3rd grade literacy rate and our pathways to student success. And by 6th grade, students who are chronically absent, that is their #1 leading indicator as to whether or not they will graduate from high school. By 6th grade, by 11 years old, that is the lead indicator. And finally, we all know that our families that are struggling with the most poverty or the financial challenges are 4 times more likely to be chronically absent, often for reasons that are outside of their control. Next slide, please. So why is this? Right? So specifically since the pandemic, but this is something that I think has been mentioned, that has been evolving. There's been a culture shift, as I'm sure you all are out in schools, and especially our secondary principals will tell you, there has been a culture shift in how parents and families, especially older students, perceive the need to be physically present in school in order to learn. And this is not relegated to a certain student group. Right? This cuts across socioeconomic status, grade point average, what have you. We learned during the pandemic that substantive learning can occur, not always, but may occur online. Our entire district since about 2018 has moved towards online learning platforms with Canvas. Most students, the first thing they do is log into that Canvas page. They see all of their courses, their assignments are there, their homework is there, their grades are there. They're submitting things online instead of bringing it in paper on a day-to-day basis. So the perception of in-person learning has changed. As has been well documented, we are still in the midst of a youth mental health crisis, and whether it is because of bullying, if it's because of school phobia, if it's because a student may feel as though they're subject to microaggressions in their school, whatever it may be, students are staying away because of their mental health. They see this as an easy short-term fix to alleviate these deep-rooted symptoms. And ultimately, some students don't see themselves in their schools or their community. We know this. The anti-racist audit data has told us this. If you do a focus group with some of our students of color in certain schools, they will tell you this. And so we have centered that data and that student voice in our work. And we know if students don't feel welcomed or included, right, or part of that school community, they are less likely to come. And this fourth one is something that is all ultimately significant. I think will go a long way towards how public education, frankly, evolves in the 21st century. We are living in an antiquated system that really hasn't changed that much since the early 20th century. It certainly probably hasn't changed except for the technology in the room since those of us in this space have been in schools. And we are asking our students to sit, especially our secondary students, sit in an environment that is unlike anything else they will ever be asked to do in their lives. 45-minute blocks of singular information receiving, only being able to use the restroom every 45 minutes, over a 7-hour day, right, over 10 months a year, a very inflexible, institutional, and I use that word specifically, environment that was designed for different reasons, for different students, for different ends. We have got to be, and we are advocating, as you'll hear later, with with those folks in Annapolis, about really looking at these requirements and why are we requiring what we're requiring in person. Let's lean into the technology. Let's lean into the flexibility. Let's think about creative ways for students to earn credit, whether it's through internships or work programs similar to like you have at junior college or other university programs. Let's think about how we can evolve to meet students where society is today. And finally, the last one is huge. Some students wake up in the morning and they're making a business decision about coming to school. Am I coming to school to learn what may or may not be, right, important to me versus going to work, right, or earning some money or staying, even if I'm in 5th grade, staying home to take care of my 5-year-old brother or sister because my parent may have to go to work, or I'm going to go work that job part-time because I need to help my family. So this is just the reality of where we are. Next slide. So the good news, I think, as Ms. McGuire shared, is that we have developed a multi-pronged approach to attendance. And again, it is not a plan, as you'll hear, with a singular magic wand that is going to get us out of this. But we have really, again, focused on what we can control. And as we come out of the gates, this is first marking period data, right? We spiked last year with 26.2% chronic absenteeism. Our system goal this year is 5%. We hope to reduce chronic absenteeism by 5% of June 30th and 24. So far, we are just about there. As was also mentioned, the high school is always, or has been traditionally, the highest level of chronic absenteeism. After first marking period, it's just a hair, but we are slightly below pre-pandemic levels of chronic absenteeism in the high schools. Next slide.
So these slides exemplify that chronic absenteeism does not impact all students equally or equitably. Traditionally in MCPS, our Hispanic population has stood out beyond all other
Steve,
groups.
just introduce yourself.
I'm sorry?
That's all right.
Good
We
morning.
all know you, but we want everyone else to know you.
Right. Good morning. Steve Neff, MCPS Director of Pupil Personnel and Attendance Services. Thank you for that reminder. So our Hispanic students have stood out beyond all other groups as having the highest chronic absenteeism rates, followed by our Black or African American students. These data show that we're making the most progress with our most impacted students, but there is still more work to do. Similarly, our emergent multilingual learners and our students with disabilities have been disproportionately chronically absent compared to students not in that service group. The second graph shows that we are making gains with these groups as well. While the data available to us has changed for students in poverty due to confidentiality concerns, we do have access to Title I schools data to show that we're making commensurate progress with students in those schools as well. Next slide, please. Given the national trends described earlier, it makes sense that national experts are conducting research to determine the most common root causes behind chronic absenteeism and targeted interventions to address those causes. Here are some of their findings. And as Mr. Monteleone said, not a single silver bullet, mostly about connections and engagement. All four of these bullets are rooted in relationships. The comprehensive approach that I'm about to share is rooted in the anti-racist work we are engaged in as a system, specifically focusing on building and maintaining relationships with those groups who have traditionally felt less connected to MCPS. Next slide, please. So we have a theory of action that if we address chronic absenteeism through a data-driven, collaborative, and multifaceted approach, which includes significant proactive and responsive strategies, they will enable students and families to attend school consistently by reducing barriers to school attendance. So we have implemented several changes in MCPS structures to address student attendance. We have updated our school improvement planning process with the addition of student well-being and school culture and climate goals. We also have, through student well-being teams or separate meetings, bi-weekly attendance monitoring meetings. And in those meetings, we ask the question, which student groups are attending less regularly and why? And then the subsequent question, how can we proactively engage those communities? We also continue with individual student and family collaborative problem solving. Which students and families are having difficulty getting to school, what barriers need to be removed, what resources are available and needed, and then we document and monitor those efforts in a multi-tiered system of supports. Mr. Monteleone mentioned looking very frequently at qualitative and quantitative root cause analysis data. All schools continue to look at their school culture and climate and student well-being goals in their efforts, because both of those things have a direct impact on student attendance. They look at a variety of data points, including the anti-racist data, as well as voice data from caregivers and students. And then they're continuing to look at patterns of real-time patterns of their attendance. Are there student groups? Are there times of day? Are there times within the calendar, like holidays? Are there particular class periods where students are missing and why? Each school, as I mentioned, has a specific attendance data protocol for how they look at those data, how they are going to engage with parents in outreach efforts. And we'll talk a little bit more about where we're moving in that direction in a minute. The school supervisors, the directors and the associates who supervise principals, along with my office, we monitor attendance weekly and we plan school-specific support in real time. And then the student well-being teams continue to monitor their attendance. We have what's called a Friday roll call, which is organized by our deputy and is a meeting of senior leaders, and we look at several data points, attendance being one of them. We also look at suspensions as well as hate bias and bullying claims. And the purpose of this meeting is to look at these data weekly, week over week trends, and then we can have immediate action items where we can send principal supervisors as well as support from our office to work with those schools to try to redirect trends that might be heading in a direction that we don't like. Similarly, we meet twice a month with those directors and associates who supervise schools, and we share data and we think about action items of how we can collectively support schools. We've also pulled in all of our school-facing staff members and shared our key data points around attendance, suspension, and student well-being teams, letting them know that they all have a part. It is not a singular staff member's role to address attendance. You can go to the next slide, please. So here's an example of a student traveling through a process. The student well-being team is a multidisciplinary team consisting of a school administrator, school counselors, pupil personnel workers, parent community coordinators, social workers, ETCs or emergent multilingual therapeutic counselors, and other teacher leaders, school nurses as well. The team members, especially the pupil personnel workers and the parent community coordinators, they really know these families. They understand the challenges that the families have in the home and the community, and they've built trusting relationships. And as Mr. Monteleone said, we've built the relationships, or we try to build the relationships, so they will tell us about what their struggles. Because once those barriers are understood, the student well-being team members connect the family with school system and community resources through warm handoffs. Next slide, please. So in MCPS, we are committed to implementing anti-racist strategies and delivering culturally responsive instruction. Prior to the school year, each school took a look at their anti-racist system data and their student and parent voice data and their attendance, and they cross-reference those. And the goal was to seek to understand which groups were not attending school and why. This is an example of a high school that has made significant gains in the first quarter. And when I reached out to the school and said, what is it that you've done? It was about that outreach and the interventions. The pupil personnel worker, the school counselors, and other members of their student well-being teams, they did proactive outreach, phone calls, text messages, parent meetings, student visits, student meetings, and home visits. They have a wellness center, thank you to DHHS partners, and a school-assigned MCPS social worker who are all collaboratively working on this, because the theory is one of those staff members I mentioned has a relationship with either the child or a caregiver and can learn what those challenges are. And just a quick reminder that we are going to come back, not me, but MCPS is going to come back to you on November 30th to provide an update on our anti-racist action plan. Okay, next slide, please. This was mentioned multiple times. We so value our partnerships, and we want to specifically thank the Bridge to Wellness, Linkages to Learning, Community Schools, the Department of Recreation, and our partnerships with our nonprofits. And thank you specifically to DHHS for the many partnerships we enjoy. We also have a very special relationship that was mentioned with the State's Attorney's Office, who you will hear from shortly. I'm not going to steal their thunder, but I will just mention we are in partnership to implement the Truancy Prevention Program, which is currently in 19 out of our 40 middle schools and 1 high school, and we're working together to try to expand into 5 more for the second semester. We are also partnering, and Mr. Monteleone mentioned research from them, with Attendance Works, who is a national leader in focusing on the issue of chronic absenteeism, and we have contracted with them to engage in a pilot and an attendance community of practice pilot with 16 schools across 2 of our clusters with the highest absenteeism rates. And finally, what has been shared so far is what is immediately within our control. And as Mr. Monteleone said, there are so many factors we can't control, and we're really focused on what are the things that we can control, and that is analyzing data, enhancing accountability and reporting structures, and engaging students and families. directly supporting students. But this is ongoing work because there is not a simple or a one-time fix. So what we've shared so far is what is presently placed, and I just want to take a quick minute to note a few places where we are moving forward through the course of this school year. We're working with colleagues in our technology office to create automatically generated messages through our student information system. These messages will occur at certain absence thresholds and will be in the parent's native language. They will be culturally responsive, informative, encouraging, and will offer supports. And this is in contrast to, we have attendance letters now. They are sent intermittently, and frankly, they are not as culturally responsive or as encouraging as they could be. So we are looking to beef up and improve our efforts there. We also know, and Mr. Monteleone mentioned this, we have a commitment to look at anything and everything that could negatively impact attendance. And it was said, almost every component of county and county services has an impact on families and attendance. So we're looking at innovative ways to reshape the paradigm of teaching and learning. We're looking at all of our policies, including grading and reporting, our course offerings, as well as alternative ways to offer instruction that meet the needs of students who may not be available during the traditional school day. And finally, our senior leadership, as Mr. Monteleone mentioned, and our Board of Education are actively engaged in legislative advocacy surrounding current graduation requirements that do not fully take into account the unique needs of all of our learners, especially our newcomer students. So I will now, I believe, are we going to move directly to the
Yeah, we're going to
State's
go right
Attorney's
into the
office?
state's attorney.
Okay,
We're all
turn it over
chomping
to
at
my
the bit,
colleagues.
but we want to have a complete picture here. So introduce yourself, ma'am, and I know we have. If you want to go first, John, we start with the
I'm
State's
going
Attorney
to
John
take
McCarthy.
2
You can
seconds.
Turn over to his team.
Thank you, Councilman. I'm proud of this association that I have with the schools. We started in 2009. Hopefully, we'll be in 26 schools. We started with 2. We've always had the tremendous support of the County Council in this. Valerie Irvin was one of our early heroes getting us funding for this. Dr. Judy Daka has been involved in this all the time. Mr. Katz, I don't know that you've missed a graduation. I know you've been there. You've helped us give out diplomas. I got here early to make sure you couldn't say that about me this morning. Look, Mr. Neff and I have developed a tremendous partnership in this program, and we try to listen to each other. I'm very proud of the fact that we are servicing, not because we're identifying, 90% of the kids we're servicing are minority kids in our community. And I'm very proud of that. Same way that when Gabe ran the sports departments and the rec departments, we helped kids. I worked with Gabe when he was head of recreation here. We work with kids. I've always fundamentally believed it's better to have a kid in a classroom seat than in a jail cell. I think this is a smart strategy for us to reduce youth crime in our community by re-engaging our kids in their education. I don't want to steal any additional thunder, but it's an honor to be here with you on this very important topic today.
Thank you.
Good morning. My name is Rebecca Marcolini, and I'm the director of the Truancy Prevention Program. And today I'm going to present a presentation on the SAO Truancy Intervention Programs that we are a part of. If you could change the slide, please. First, I'm going to talk about our program that we have the most time and attention and resources to, and that is the Truancy Prevention Program, also known as TPP. Next slide, please. The mission of TPP is to serve as an early intervention program targeting students who are between 10 to 20% truant, and its mission is to improve the attendance of students by discovering the root causes of truancy and absenteeism by assisting students and their families in addressing issues that impact attendance. Next slide, please. Our approach is to improve students' attitudes on education, provide individualized goal setting and individualized mentoring, and to help students in the end achieve their full potential. Next slide, please. So studies have shown the positive impacts of mentoring include 52% less likelihood to skip school, 37% less likelihood to skip class, 33% less likelihood to hit someone, 27% less likelihood to use alcohol, and 46% less likelihood to use illegal drugs. Next slide, please. So currently, we have added an additional school, 2 additional schools this semester, and we are currently at 20 schools out of the 40. There's 40 total middle schools. We are in 19 of them, and we are also piloting 1 high school, which is Northwood High School. And here's a list of all of our schools. Next slide, please. So the TPP program is a partnership among the state's attorney's office, MCPS, and volunteers that serve as mentors in the program. Next slide, please.
All right, is that picture accurate at the state's attorney's office right there? Go ahead, continue. You look good, John. Go continue.
So TPP is held twice a year, and each semester, there's a fall semester and a spring semester. Each semester includes 10 TPP sessions with the students plus a student orientation. So a day in the life of a session includes the student first being called down by the school individually. The student then meets with up to 1 to 2 mentors. After the mentor session, the student will go into the panel session where they meet with a variety of TPP staff, which includes a site coordinator from the state's attorney's office, a facilitator from the state's attorney's office, and a staff member, which normally includes a pupil personnel worker or a counselor. And the team together reviews the students' attendance and grades. They encourage students through praise and incentives, which they can gain points for completing certain parts of the program and cash in for incentive prizes. They encourage self-advocacy and helps brainstorm solutions to problems to help, and also help students set goals. After all of the students have been seen, the mentors and the panel session meet together for a debrief to review how the session went for each student and come up with action items on how they can help that individual student and do whatever they can to help improve their situation and help them with identify the issue for each and every student and what the root cause of their truancy is. The end result after several weeks is that students begin to improve based on increased engagement with their support network. Next slide, please. So when the program is complete, a graduation ceremony is held at the courthouse across the street, at the circuit courthouse. So participants that successfully complete TPP from all the schools are invited with their families to attend the ceremony. 3 student speakers are selected for each graduation, and students receive certificates and graduation gifts, and a reception is held afterwards for them and their families. Next slide, please. Here's a short video of 1 minute, if it works, we can. Of it.
Village, and you may recognize TV live last week program.
And with confidence. So for that.
Okay, this is an example of one of our TPP graduations, actually the last one that we had, in which Councilmember Katz observed. Next slide, please.
Israel.
And another program I wanted to mention is our SAO Summer Camp. We held our 2nd annual SAO Summer Camp this past summer, which included middle school students. If you could switch to the next slide, please. It serves TPP students, so all TPP students that are part of the program receive a special invitation to attend this free camp, and other MCPS students, which is one week-long camp, and it includes a variety of different activities, some of which include a lot of initiatives that we are putting forth through the Community Outreach Division at the State's Attorney's Office, which includes healthy teen dating, opioid abuse prevention, mental health and wellness, crime prevention, drug and alcohol education, presentations on and activities on peer pressure. We also have the K-9 unit come and provide a presentation to the students. We provide them a tour of the courthouse and the sheriff's office, and they take part in a mock trial here at the Circuit Court building. Next slide, please. The other program that the state's attorney's office takes part in is the Truancy Review Board, which is run by Montgomery County Public Schools. So the Truancy Review Board is the last step in the process before MCPS sends a violation of the compulsory attendance laws to the state's attorney's office for prosecution. Truancy Review Board, also known as TRB, is an informal multi-agency hearing that is designed to help families and students get to school and provide assistance from various agencies that are a part of the TRB panel. And the agencies that are involved in TRB are as follows on the next slide. Director of Pupil Personnel Services, Montgomery County Public Schools, Department of Student Services, Department of Juvenile Services, the State's Attorney's Office, Child Protective Services, Montgomery County Department of Health and Human Services, Child and Adolescent Mental Health Services, the Housing Opportunities Commissions of Montgomery County, and Every Mind. Next slide, please. The goal of the Truancy Review Board is to identify the root cause of student absences. So students with a 20% rate of absence is the baseline for referral for TRB. And the TRB provides services to help the family and child get to school on a regular basis, discussing background information on the students and families, information collected from counselors and PPWs, and providing directions for students and families, and directing families to be more responsive and maintain contact with MCPS, and most importantly, inform and warn parents and custodians about the compulsory attendance laws in order to provide an opportunity for the family to avoid court. Next slide, please. So if the student's rate of absence is more than 20% and prior interventions have failed, such as the TRB, then the case can be referred to the SAO for prosecution, in which case an information is drafted for the violation of the compulsory attendance laws, which can be found in the Annotated Code of Maryland Education Article, Section 7-301. And the person who has legal custody, care, and control of the student would be the person named on the information. And that concludes my presentation.
Thank you. Really appreciate the information from both, and I thank you for being expeditious and getting through that. So it gives us a good amount of time. So I'll have a few questions. I'll turn to my co-chair, and then we'll go to the colleagues. And I think I've got everyone in order now. For MCPS, you know, I mentioned in the intro, this is obviously an issue affecting the whole country, a lot of our schools in different ways. But I have noticed, and I wanted, your data doesn't demonstrate it here, but I would like to give you an opportunity to speak and then maybe come back to us with some information on, are you seeing higher rates in certain clusters in certain schools? Because I have noticed that anecdotally. We're going to have a briefing later in our Planning, Housing, and Parks Committee where the Planning Department is going to give us an update on demographic trends. And, you know, I read through the report over the weekend, and we are becoming more segregated, right? Socioeconomically, racial, and ethnically, largely driven by the cost of housing, but in availability of jobs. And so I would wonder if this data, are you seeing it in some places? You know, Councilmember Katz and I were at a middle school, I think elementary school, where they were seeing, 100 some kids a day that weren't showing up, right? And obviously that's not the case at every school. So could you speak to that, and are you tracking that data and looking at it in that way?
Yeah, absolutely, and thank you. So I'll start off. I think so. Steve spoke, or Mr. Neff spoke to a couple of the new structures and processes we have in place, and I also really want to reiterate this, right? So prior to the pandemic, schools did this work at the counselor office level only, without a central infrastructure that was monitoring these data in real time.
Right.
Okay? And often we looked at the data in a lagging way, right? So there is with the advent of the
So
student
that's a
well-being.
big change in the
Huge
last
change.
couple of years.
It's a huge change because we are addressing these non-academic data points the way we've always looked at academic data points. I can't emphasize that enough. And so the answer is yes, but I want if the council could keep in mind, the student well-being team, the advent was during the pandemic. It has evolved greatly. We are thankful for the Bridge to Wellness staff who partner with our student well-being teams at the high school level and the Wellness Center, as well as these other structures and processes. Through our district level structures and processes, we are monitoring by school. We are monitoring by cluster. We break the data down in numerous ways, but one way is on this weekly roll call, we look at schools that are hovering around 25% chronic absenteeism, okay? Because again, look at that baseline goal from last year at 26. So we look at those schools and those clusters. And Steve can speak to some of the individual data, but the common denominator is our Hispanic population, and specifically our EMLs, and specifically at the secondary level, all right? So where that population is greater, you tend to see greater chronic absenteeism, specifically at the upper levels, all right? At the elementary level, we have, interestingly enough, there's some culture building around pre-K and kindergarten attendance. It's not just optional, right? I'll take the kid when something else is better, then we'll keep him at home. So we look at that data as well. So we are looking at that. We do have that, and that is the common denominator. I'm not sure if you have anything to add.
Yeah, just very quickly, the answer is yes. We had the attendance works data point where students in poverty are 4 times as likely nationally to be chronically absent. And when if we were to line up any schools at any level from the highest to the lowest farms rate and the highest to the lowest chronic absenteeism rate, those schools would line up very similarly down the list, and there's an opportunity there to look at schools that may show up distinctively different on the
Right.
list. You know, what is this school down here doing, and why is this school struggling more than their farms data suggests they might? But it is very much aligned with.
And where would someone, I often say the millions watching at home, where would someone, without having to go schools at a glance and dig up each individual attendance rate and compare themselves, is that presented somewhere in a way that's easy to digest?
So soon, we're working on that. I believe that you have heard about the new dashboards that our technology office have created, both for real-time data access at schools, but also the public dashboard. We are soon, I believe second semester, that the public-facing dashboard will be there, and it won't only include your academic pathway data points, but it will have chronic absenteeism.
Right.
This is happening in real time.
And if just as a follow-up for this joint committee, and I would like to see the data in the trend lines that you're talking about on the schools and the base clusters. I think one of the biggest issues here is, we talked about the impact of mentorship and how this needs to be a community-based approach. Part of that is making sure people know where the need is most urgent, and so that we can use that as a catalyst. You mentioned attendance is a lead indicator of high school graduation, so we should be following that just as much as any other. Okay, thank you on that. Mr. Neff, the other question I have for you, and then I'll turn to colleagues, is the PPWs and the PCCs. Where are we? They're critical in every slide the process. They are like right at the heart of knowing what's going on, getting to it. The ones I know are stretched thin and great people, but there's not enough of them in my view. Could you talk to us about where that is? What's the current lay of the land about how your staffing and what you're able to cover and how many schools and what the plans are going forward to obviously improve those ratios?
Sure. So I supervise the pupil personnel workers. So there are 54 pupil personnel workers spread across our 211 schools, and they're not spread equally. So a pupil personnel worker in a school with a cluster with higher needs, like a higher poverty rate, would have far fewer schools than a pupil personnel worker assigned in a cluster in Bethesda or Potomac, for example. We've continued to increase our parent community coordinator ranks. We are are, slightly over 50 there, and they are not assigned to every single school in MCPS, although every school has access to their supports if needed. They are assigned similarly based on our farms rates, and we've increased other staff member roles that we know have a direct impact as well in terms of school counselors, social workers, ETCs. So yeah, we are stretched. But and the PPWs are the ones who, one of their top, I would say 2 or 3 primary functions is really helping schools around their chronic absenteeism work.
So 50 PPWs, chronic and that's not their only role around absenteeism. They have other things that they do, right? I think this is an area, again, attendance lead indicator of high school graduation. We have some groups where it's 30% chronic absenteeism, right? And we have 50 people across 211 schools. Our average middle school's 1,000 students, a couple thousand at a high school. These the numbers are tough. And I just would think that I would like to hear more from you all. And I know you have to work with your board and make the request, but as far as bang for your buck, this is an area where I think, because the data is so strong, that we need to be doing more, not less of this. I know you all agree. You're just hearing it specifically from me. Last question I have for the State's Attorney's Office, and I'll turn to Councilmember Katz, is if you could follow up and you speak to it now. I know obviously you have these great programs where you're trying to do everything you can to not get to prosecution, and I'm glad that it's continued to expand in the various schools. But could you give us a sense of what is the scale of the issue of how many are getting to the point where you're having to move forward with the case? And has that gone up or down over the last few years?
Well, because of limitations and resources, each school has a maximum of 10 students each. So the actual number of chronically absent students at those schools is typically much higher than that. So
you're talking about to participate in your program,
yes.
Which is also a good question, but that's not the one I was asking.
I apologize.
So 10 students per school can participate in TPP right now?
Correct,
okay.
at this time.
So obviously that's a limiting factor, but there's other mentorship programs in schools that hopefully would help. But I was speaking to the issue of if someone gets to the SW, no, there's a lot of B's, not the SWB. They've gone through the SWB and now they're at the Truancy Review Board. How many cases are being put forward?
I can speak to that. So we made a reasonable and conscious effort during the pandemic to completely, suspend any truancy proceedings because of everything going on. Since we've come back, we are at less than 10 a year. Okay. I would say 5 or 6 a year. Because
individual cases.
Individual cases.
These are the worst case scenarios.
Right.
No one's
worst case scenarios, because very frankly, I run the MCPS side. George Sims, who works for Mr. McCarthy, works the State's Attorney's Office side, and we are extremely reluctant to want to go, we bend over backwards to try to do the engagement and the relationship building, and many times we're able to do that in the Truancy Review Board session. So it is only the most egregious cases, often with our youngest students, that get that far. And even when it gets there, our goal is not to punish, fine the parent or jail the parent. It is to try to build back a working relationship so their children can come to school.
Can I just, I've talked to George about this, Mr. Sims, who heads this unit, and I don't, nothing that Mr. Neff said, I contradict. We've been looking, I think everybody who is involved in this truancy issue has to use all the tools that are available to them. Our prosecutions, like literally prosecuting somebody, 1 or 2 a year. That's not our goal. Our goal is not about prosecuting parents. Our goals are about problem solving with other resources that are brought to bear with that parent when there's a constellation of different agencies there. We participate in it. It's a tool we have. I have been involved in an active conversation with George about particularly focusing in on younger students. We have issues where when you get to high school, 16 or 17-year-olds, you don't have compulsory attendance, and then in some instances you have kids that are out of the control of their parents. They're really doing what look, I put them on the bus, I put them outside. If you didn't go to school, it's not on me. I'm not going to prosecute a parent in that kind of situation. But I do think that we are engaged in a conversation, particularly about the youngest members in the grammar school eras and years, looking at parents are not sending their kids regularly to first, second, third, and fourth grade, where they are in control of the kids. If that's a tool, and again, this should not be about locking them up. This is the last thing we want to do, but we may want to focus and use that tool more often, particularly in that segment of the community where the parents really still do control their children's behavior, and they may be far more responsible for the child not attending. It's not because the middle school age kid or the high school kid just decides to blow school off. That's not what we're talking about. So we are engaged in that conversation and trying to refocus ourselves on how best to use that limited resource, which with the ultimate sanction of actually going after a parent,
Appreciate
which is
that.
not our goal.
Yeah, obviously, we want intervention, we want to change the behavior. And okay. Thank you. Oh, yes, please, go ahead. Just press your mic there and then introduce yourself, please. There you go.
Thank you. Good morning. I'm Linda Earl. I serve as an assistant state's attorney in Montgomery County, and so I just wanted to share with you as a stepping stone to what Mr. McCarthy just said. Before we even get to the Truancy Review Board, families would probably have gone through the wellness meetings at the public school system, attendance matters, which I think now has another name, cluster groups, as well as our program, the Truancy Prevention Program. So we take every measure to work with the school system to ensure that we don't have to prosecute parents.
I appreciate that. I'm sorry, Mr. Katz, I lied. I have one other question. And then to the school system, I heard this specific, and I told the teacher I'd bring it up. I've heard it from several teachers. If a student, particularly most likely in the high school setting, shows up to the class 20 minutes in, they're still marked present. They do that half their classes. They've missed half the school year. They should technically they've missed half the information. They're much less likely to graduate. But under the current policy, my understanding is that student would not fall into this data. Is that correct?
So this is actually a very gray area and ongoing. So the state, MSDE, just recently, and this is not technically my shop, so I'm speaking a little bit for our Office of Shared Accountability, but the state of Maryland just recently put out some metrics on this by either a 45-minute period or a block period for feedback to all the LEAs. MSDE is looking to put out a statewide guide on this exact question. So where that is in the process is they have put that out. They've asked for feedback. Our secondary folks specifically are providing that feedback. Like right now, we just spoke to the high school principals about this last week, and then getting that back to the LEAs. So as it sits right now, this very moment, right, we have those thresholds are what they were before the pandemic, which is essentially that, right? So we are working with the state as they develop these statewide guidelines on this, but that is an area that we have our eye on as a district that has been elevated to us by teachers and by administrators and certainly by the students themselves.
So just to be clear, as I said, as I stated,
Yes.
that's correct.
The answer is yes.
And whether or not the state changes, I will say, and I think most would agree, we should be tracking that data because that means our numbers are not accurate. That means there's a large percentage of students that are chronically absent, that are not getting the content information. Now, whether there's a penalty or not is a separate question, right? And that will come with guidance from the state. But we need to at least know for all these other interventions who is in that category. And I know, for example, at some high schools, this is a major issue where you have kids that are in school but missing half the day because for whatever reason. Just want to pass that along to the people that do that. Councilmember Katz.
Thank you very much. Again, let me start off by saying thank you for doing what you're doing. I know you never get enough thanks, and this is perhaps one of the most complex problems that we all have to deal with because it's life-changing. If we can get that young person, and the state's attorney's office has certainly worked on this, but if we can get that young person back on track, we're so much better off. I do have a concern, though, about saying somebody that is chronic, is ill, and they're not in school because of an illness, to put them in a position. I mean, you don't want them coming to school if they're ill, and to put them to say that they're a chronic to deal with the chronic absenteeism. Is there a way that that can be worked on? How does that work?
So the answer is no and yes. The
Well,
no
that
part.
clears it right up. Yeah.
So the no part is chronically absent is hard data, and it basically says, are you in school or are you not in school? So if you're not in school and it's because you had COVID and you missed all last week,
Yeah.
you have 5 absences. But the reason that we are looking at data in a real-time way, and then we're digging into who are the students behind those data, there are students for whom we wouldn't do anything more other than just monitor. So for example, there may be a student who missed the first 5 days of school because they had to travel for a family emergency. We just had the 50th day of school, I think the middle of last week. They would have been chronically absent all the way through the middle of November. But if they had been at school every day since after Labor Day, there's no reason to intervene with that family. Monitor and see how things are going. So when we look at our students who are chronically absent, we need to look at sort of the when and the why behind that. Because right now, anybody with 6 absences is chronically absent based on when we are on the school year. But all of those students fall into a variety of different categories, when it was, why it was, and so we look at that trend data. And so to answer your question in the yes format, we don't, even do outreach to those families because it is not a problem.
Right. There's nothing we can solve right then.
Correct.
We talk about the farms, the free and reduced meals, and in some cases, those students, it might be the only meal they get is if they come to school. What happens to that student that is a truant that is not coming to school? How are they being fed?
So it's a great question. So, I mean, but clearly, if we are providing that meal at home, but this would be one of the things that the student well-being team would triage, right? I think so. Mr. Neff just spoke to the fact that if we know a student was out for 4 days because they had COVID or what have you, that student is not going to be elevated to like a tier 2 intervention through the student well-being team or the attendance team. So I think that ultimately with that triage, right, as that when you have a counselor, the PPW, the PCC, the social worker, you have the administrator, all in the student well-being team, and they're literally looking kid by kid, they should be able to triage the root cause. And if the root cause of this, for example, this student who we know is on farms, we know is not coming, then we would want to be out in that home, or we would want to use the resources of the people that know the family best. Is there a financial insecurity issue? Mm-hmm. Is there a food scarcity issue? Mm-hmm. Is the student not coming to school because they have to work to provide food? So we would really want to get to the root of this and figure out what the issue is. And that is where we connect folks with the resources that are outside of the school's purview, right, through the resources of the county government, right, and the things that we provide. And that's why specifically at the high school level with those Bridge to Wellness teams and the wellness centers, we have linkages to learning. We have a lot of other resources. We have our focus schools. We have our Title I schools, right, at the elementary level. Where we have the most desert, right, of resources is frankly at the middle school level. We have developed a new process for social workers to be available there. But I highlight for you, right, how we would ascertain that student's specific needs and how that would occur at the various levels.
I appreciate it. If a child is suspended, are they considered a truant?
No, it's an absence, but it is an excused absence. So any suspension day is an excused absence.
And during,
let me clarify, right? So it's excused, but it does count towards the chronic absenteeism rate.
I see.
Okay.
And I'll add one more thing. Anytime we are having conversations with our supervisor and our principal colleagues, we are reminding them of the nexus of suspensions and chronic absenteeism.
And during the online learning, during the pandemic, do you know how much truancy and absenteeism? I mean, somebody can say, yeah, I'm here, but, they weren't. Do you have any idea how bad it was? Well,
so our data shows not that bad, and that is because, as you said, logging in is not the same as actively engaging. And very frankly, we were giving a great deal of grace. So you're right. I mean, and staff members currently in our Montgomery Virtual Academy are working through these things. Being present we have to define what being present, if you are assigned in a virtual class, we have to define, and we are defining what being present means.
I just wanted to add regarding
Sure.
addressing chronic absenteeism and selecting certain students. I just wanted to comment that for the truancy prevention program, the students are actually handpicked by the schools, and they do have meetings with the pupil personnel workers and the counselors that have individually worked one-on-one with these students to refer students who are more of need, rather than just going by a list of chronic absenteeism and selecting the ones that are at the top, which, as we discussed, could be a result of illness as opposed to actually students that are not coming to school for other reasons.
Right. You know, I think the school calendar from the very beginning was based on work. It was based on agriculture. It was based on the harvest seasons, et cetera. And I don't know how much of that has really changed in today's world, candidly. If a child is staying home to watch a younger brother or sister, then it's based on work. I mean, the parent is saying, look, I got to go to work. Somebody's got to watch the other children. So when that happens, when we have a child that's staying home so that the parent can work, is there a way that we can work through, and I understand everything is money. I mean, I'm not suggesting it's anything other than it. But is there a way that we could help that family, help that child, so that the child who's staying home to watch the younger siblings, that we could figure out some way to get them, you know what I'm asking, to get them out of that house?
Yes, and again, it becomes a capacity and resources issue, but we do have relationships with all of the childcare providers who provide supports in our schools around, a certain number of scholarships that they're willing to give. And we also have, relationships with county agencies that, can provide childcare vouchers, because that would be one of the interventions we would try to implement, is to, if childcare is the concern, can we connect to the parent to childcare that is affordable or free?
And I got one more, and I'm going to stop. But I just want to say that you go to the graduations for the truancy, and it's really a sense of pride for the child, for the student, for the parent. Their pictures, the whole. I mean, it really is a celebration, and they realize some of this is that they realize that they're not forgotten, that somebody actually noticed that they weren't there. The families are in many cases are so very proud, and it really proves once again that it takes a village to get that child help. We talk about the school to prison pipeline. This is a way to sincerely avoid it. That education is a key to be successful. Make certain that you're there to do it. So I know that these are all tough issues, but in many cases, if we can get this done early enough, we really are helping society in general for many years. And with that, I'm going to stop. Thank you.
Well, thank you, Councilmember Katz. Councilmember Lukey.
Thank you. So just since y'all were talking about data, and for the millions watching at home, as you always like to say, there is data available that's comparative. You can drill down by school district or by school for the entire state of Maryland at reportcard.msde.maryland.gov. It is not real-time data, so you all were talking about having real-time data available, but it would allow folks who want to dig into things at the elementary, middle, and high school levels to do so. So a couple of questions. You were just talking, and thank you, Councilmember Katz, for bringing up the issue about before and after care. And as I understand it, those are not programs that are run directly by MCPS, but there are contractors that are available. Is there a contractor available at each of our elementary schools like KAH or RT, et cetera? Do all of the elementary schools have that type of coverage?
So I do not have that exact data, but the answer is no, not every single elementary school does.
Okay.
But I don't have the numbers beyond that.
It would be good to know which elementary schools are still without that type of coverage, because that would help inform what needs to be done in terms of curing a gap in that need. I know we were talking about, or there were questions about how many cases actually get prosecuted versus, other interventions earlier on. And there was a distinction made between during the pandemic and now. And so, the virtual learning period, the formal virtual learning period, I will call it, because I know we still have Virtual Academy, ended at the end of the 2020-2021 academic year. So, but it's my understanding, and please correct me if I am wrong, that these truancy processes, not talking about the state's attorney's office program, but MCPS's sort of more formalized truancy policies were not being enforced during the 2021-2022 school year, and may not have been enforced during the 2022-2023 school year.
No, we were conducting the Truancy Review Board during both of those years.
Oh, you were? Okay.
Yes. The referrals were less than they were pre-pandemic, but yes, it was in operation.
So when there are referrals made, and I noticed on one of the slides, it used a term called soft truancy, and it was noted at 20% absenteeism, inexcused absenteeism, because truant focuses on unexcused absences. But I guess I did some number crunching, and 20% of the 180 days in the school year means 36 days absent. But the threshold in state law for definition of who is truant is 8 days in a quarter, 15 days in a semester, and 20 days in a year. So could you all speak to how that number of 20% is used, or why, since it's a higher threshold than what state statute defines as constituting truant?
So again, our chronically absent data point has always been 20% or more unexcused, but I do know that the state definition does. We're not overly stringent on, like, we would not deny a case going to the Truancy Review Board because you are at the state threshold, which is maybe end up being 17 or 18%. We do use that as sort of an underlying baseline, because what we don't want to see in the Truancy Review Board is some of the cases we described where it's housing instability
Right.
or illness or things like that. But when there's an issue with chronic absenteeism, we're looking for them to be at or approaching a 20% unexcused. So we wouldn't turn one down based on the discrepancy between our 20% and what the state does with their 8 days and 15 in a semester.
Yeah, and I just want to make clear, because you were using some terms interchangeably, and so chronic absenteeism may include excused absences. So they may be
chronic absenteeism.
yes, but truancy does not.
Yeah, right. Truancy is unexcused absence.
Right. So my concern is, when I think about sort of the it's like a spectrum of different things that occur, and it may occur with a child. And I'm going to raise my hand. I was one of those kids who had an issue medically during 1 year of high school that prevented me from getting to school on time. So I missed first period a bunch of times. Right. And there was no ascertainment of the why. Right. And I graduated third in my class. Right. So it was not impacting my academic performance, but it was an unfortunate medical issue. What I'm concerned about is, I hear the work that you're doing on the chronic absenteeism, where you're being alerted and you're reviewing with the team of folks who need to support the students and figure out the plan. And I know that if a student is truant under the education article, you're supposed to do other things, right? And those are two separate, because one may be a very different issue than another. And layering on top of that we've had state law changes that say, hey, you have to allow as an excused absence when a student has a mental behavioral health care need or need to stay home from school. And so, and it's not disputed that we have higher mental behavioral health care needs both in our adult and pediatric population. So I'm worried that based on the threshold for referral to the TRB, which I would assume at that point you've already had other attempts at interventions along the line, is almost double the state number for someone being truant. Is there something we could be doing that creates another intercept earlier on in that process before they've now gone to 36 days absent?
So I'll let the lawyers in the room correct me, but so the truancy process is a legal process and the parent is the respondent. So as Mr. McCarthy said, we're really looking at parents of younger students who are really preventing them from being in school regularly. And even beyond that, they don't appear to be engaging collaboratively with the school, and they're not responding to the many resources that in these cases are almost always provided to the parent. And so that's why the truancy cases, the referral numbers are as low as they are. The answer to your question, do there need to be additional measures? The answer is yes, and they are in place. Mr. Montanone mentioned the student well-being team. That is a place at the school level to really dig into that root cause of, is it housing instability? Is it food insecurity? Is it having to work, whatever the mental health, medical health, and then trying to connect a family to school system and or community resources to address that. And then we do have a process called Attendance Matters, and it's sort of a next level beyond the student well-being team, and it's run exclusively by the Division of Pupil Personnel and Attendance Services, and it is just a next level of problem solving that involves a group of pupil personnel workers and a chair, because sometimes just the escalation out of a school staff member in a school meeting saying it, and then if a parent is asked to attend something where it is seen as more important because there are people outside of the school, then sometimes that is enough to sort of jog the stagnation loose of them wanting to connect with the school and access resources.
And I know there was a change that lowered the age from 18 to 16 back in 2018 in the truancy statute, and in terms of when you'd go forward with that. So what is done presently or could be done with those who are 16 and 17? Because if you're 18, you can sign yourself out of school and got it. But what about the 16 and 17-year-olds? In the aftermath of that change 5 years ago, what can or cannot be done?
I can just speak to it. Really is about engagement, and it's about collaborating with them, and it's finding out whether it's at the focus group level or the individual student or family level, what are the barriers, and maybe they're MCPS imposed barriers around how the student feels like they're valued, recognized, welcomed, or maybe they're barriers that Mr. Monteleone described of, 7:30 in the morning doesn't work for me. I'm not doing 6.5 hours in person for a variety of reasons. So it's really trying to figure out what it is what their goals are and what the barriers are to accessing an education to help them reach those goals, and then within what we currently offer in our capacity, try to marry those. And is it virtual? Is it evening? Is it online pathways to graduation? However creative we are able to be within our current confines, just to help the student. Because I don't think any student tells us we don't care. I don't care about my education. It's just, it is not working for me. And then if we can try to find out why, and to the extent we're able to address that is our best opportunity.
Oh, yes, thank you.
Thank you. If I may, Linda Earl again from the State's Attorney's Office. I also serve as a facilitator in some of our schools. We do have a pilot program with a high school. You mentioned 16 and 17 years old. And I just want to weave in what Mr. Katz talked about. We have an opportunity to sit across from students one-on-one. And so sometimes we actually hear and have conversations, for example, about the fact that a student may be staying home to help a parent translate at a doctor's appointment, or they may be staying home to take care of a child, a younger child. And so we have a unique opportunity to talk to that student about what it means for them to come to school every day, because in spite of the other obligations, they're heading somewhere besides where they are right now. And we also have an opportunity to reach out to counselors and the PPWs under those circumstances to try to get other resources to help the parents or whomever the caretaker is understand that the student cannot stay home and take care of a child, or that, you know, they're heading somewhere, they're going to have a job, and this is how you learn how to show up and do the best that you can. So it is really a program that is the village that's raising a child, and we, in addition to prevention, we're uplifting the student. And so we are in high schools now where that age group is, and we get resources right from the horse's mouth. We get what they're doing and find resources for them.
Right. If I could, just from a personal experience, right down the block, having these meetings, all right? You can, as a high school team, you're going to identify those students, and I'm going to isolate this 16 to 17-year-old. We're talking about a 16 and 17-year-old who is somehow in some way making a decision not to come to school. And it's not necessarily for those national reasons that we share with you earlier, right? Not working for me, I don't feel like it, I'm not engaged, whatever it may be, right? They have taken a position that I'm making decisions, this isn't important on a day-to-day basis. That is where you have to really, you're doing some parenting there with the student, frankly. And you're talking about the student's future. You're talking about what's going to come in a couple of years. You are looking at their transcript, and you're seeing what credits do you have, what credits do you not have. Do you want to graduate? Because by the time you're 16, you need to want to graduate. I'm going to be straight here. And so we have to figure that out. If you want to graduate, but 7 periods a day, and Miss Smith gets on your nerves every first period, it's not working, then maybe we abbreviate your schedule. Maybe we do a couple of those classes on online pathways in the evening, right? Maybe we figure out a way to get you to graduation sooner, or maybe extend the number of years that it takes to graduate by having some creative pieces in place. Ultimately, this may be where the old Job Corps conversation came in, where you would have conversations about GED. But I would absolutely say, I think, if pie in the sky, if I were to create some it would be wonderful, right? And I know we're in dreamland here, but if we had some sort of like FDR, CC, some sort of like work development, we are missing students who could be actively engaged members of our community through our workforce by not having a direct pipeline from that disengaged 16-year-old to a vocational or a trade or a licensure or something where they can see themselves having a future, right? So it is literally up to the school team to make that connection and figure that out at that age. But that's real. Yeah. Right, what you're talking about there.
And I mean, I know we do have the new service year program, right, that the state offers, but you have to have finished high school or have your GED to participate in that program. So, you know, that core group of 16 to 17-year-olds is so critical in that. And I appreciate the flexibility with different types of ways we can get people to the things now. I know I shadowed at my children's high school last Veterans Day. I think I was the only parent in the building. They opened it up for everybody, but I swear I was the only non-instructional, non-staff adult in the building. And it was really cool. And, you know, when I went to school, everybody sat in an individual desk and they were in rows and you were spaced out. And now it's in clusters and there's a lot more focus on group work, which is, again, a tangible way to make kids feel connected to their peers and to work collaboratively together, both things we need for them to be successful in the workforce down the pike. You know, so we do have a lot of different tools in the toolkit now to deal with that, but I do know that we have extra challenges with that 16 to 17-year-old age group that are not just impacting their educational outcomes, but they're impacting the community as a whole. And I know we did talk about juvenile justice related issues. I know the state's talking about them, but you know, there is mandatory notification for different things related to truancy that come up in the child in need of assistance process, but I don't know how frequently that has been or has not been used in the past 2 years either. I don't know if anybody from the state's attorney's office can comment on that.
I'm sorry, are you speaking about the SINS?
No.
Child in need of supervision?
No, it's 3-819 of the Courts and Judicial Proceedings article, so not child in need of supervision, but child in need of assistance.
Right, well, the SINA, we usually handle the delinquency portion, so we don't handle the SINA cases.
A lot of
Yeah,
we do
but-
not handle the SINA cases as a civil proceeding. A lot of them are brought, that relate to us, are brought in connection with a child that might be the victim of a sexual crime.
Right.
But they're in a home environment where they're being violated by someone maybe that's being voluntarily brought in or invited into the home. So there's a lot of times there are parallel SINA proceedings and criminal proceedings at the same time. So the SINA is handled by another agency, but the criminal proceeding is what gives rise to why the child's there as a SINA.
And SINA proceedings are not happening solely related to truancy, or are they?
Not to my knowledge.
No, I think that typically the tool would be a SINS petition, child in need of supervision, because in many instances they're out of control of either their parents or the school officials.
Right.
It's more, the conversation at the state level, which I am familiar with as
Yep.
well, is more about using SINS in lieu of delinquency petitions against
Right.
kids. As the issue, and I actually was at a prior hearing I think we've had one SINS petition in the last 10 years.
Correct.
Authorized by the Department of Juvenile Services.
Correct.
In Montgomery County. So
Correct.
the conversation about SINS, first of all, you need the Department of Juvenile Services to buy in, and they
Yes.
have not.
And I know that came up during the state's hearing in the House Judiciary Committee last week. Delegate Crutchfield raised it, and I wanted to make sure that the chair corrected, because she said only one had been asked for, which is not the case. It's only one had been referred to the court by the Department of Juvenile Services.
That's correct,
And
because they
there
hold
was no number, and no number publicly available on the judiciary's website that would tell you how many times they had been sought over that same decade period. Thank you.
Thank you. Councilmember Albornoz.
Thank you all. I'm really happy we're having this conversation, and I recognize that this is a national issue that has gotten significantly worse since COVID. This was a challenge before COVID and obviously has accelerated. And although it is impacting all different socioeconomic backgrounds, it clearly is disproportionately impacting particularly our Black and Brown community. And the fact that the numbers are almost twice as high within our Latino community is also incredibly alarming. About 2 weeks ago, I was at Wheaton Mall in the Dix, and there were 3 kids. This was at 10 o'clock in the morning. I had to double check to make sure that school wasn't out. It was not. It was in. And they were engaging in an argument with the store manager. And the store manager was trying to enforce a store policy which said if you're in the store during school hours, you had to be accompanied by adult. And a couple of the kids claimed to not be able to speak English. I heard them later. They could speak English quite well. But as I started going around the mall, I noticed it was impossible not to how many teenagers with backpacks were walking around loitering. And that obviously creates a whole nother subset of challenges in our community that is profound and significant, and something that we obviously have to also pay attention to. But I had a couple of questions, and obviously this is an issue, as I said, that's impacting all demographics, but do we know the percentage of MET students, of the Latino students that are chronically truant? Do we have that number?
We don't have the number specifically for MET students, but that is something I'm working with Ms. Bajorquez on, so we can get that for you for sure.
That'd be great. And the reason I bring that up is because, again, this is not a new issue. And State's Attorney McCarthy mentioned we work collaboratively when I was at the Recreation Department. And the Soccer for Change program that we established, one of the goals was to get kids to actually show up to school. And so one of the requirements to participate in the program is that kids had to show up for school. And it worked because we used this carrot methodology to find something that would link them, that would interest them, that would engage them, that could then hopefully open up other possibilities. So there was a strong collaboration and partnership, school by school level, that is critical. You mentioned, Mr. Neff, that the PPWs here are overwhelmed, but obviously really important to this because oftentimes the family situations of these students are really complex. They may have parents, but parents that they have not engaged with because they've come from other countries and there's been a disengagement. They're sometimes being raised by aunts or uncles or grandparents who are overwhelmed and need access to services themselves to be able to support their needs. How are you working currently with other sister county agencies and partners, Identity, LAYC, the Recreation Department, the Department of Health and Human Services? What does that look like now? And I know it's a broad question, but if you can refine that and what referral process there is currently when we are running into situations, because more often than not, these students are on someone's radar screen. They're being serviced by another program in some other way. And so the interconnectivity of communication is really important.
I'm going to start to address this question from the moment the student arrives at our doorstep at Rocking Horse, at our International Admissions and Enrollment office, and Mr. Neff, if you want to take it from the student well-being team perspective, because we can certainly, that's a real hub of where we provide students with access to those resources that you mentioned. So a new unit that is over the last couple of years is our MCPS and our acronyms, our EML therapeutic counselor, so our emerging multilingual student therapeutic counselor. All right, we have historically had, when I was a principal, we called them ESOL counselors, now EML counselors in the schoolhouse. This counselor is a little bit different in that they are specifically focused on understanding the student and the family's trauma when they walk in that door. So we have an assessment process when every single EML or most often MET students, right, come to Rocking Horse, where we assess where they've been, how they got here, what they had to go through, are they connecting with family members, do they have family members. So we have that entire process, and that EML counselor follows the student. They don't just triage there at the center. They follow them into the schoolhouse, and they have caseloads of students in the individual schoolhouses, all right? And that is where they'll then connect with the EML resource teacher, formerly known as the ESOL resource teacher. So at the school level, you have that EML counselor, you have the ESOL or the EML resource teacher, you have the traditional counselor, and the EML academic counselor. Also, what we have there, right there at Rocking Horse, right, are a lot of our county resources. We have legal resources, we have medical resources,
right.
We have ongoing free mental health resources, and what we have done in terms of engagement right there, the first time this year, our athletics department has set up an informational process and a system and are coordinating directly with their coordinator and the EML and the IAE coordinator. So we are there promoting in Spanish primarily, and other languages, but primarily Spanish, all of our athletic and club opportunities to try to get students engaged with something. And we do an assessment of what you're interested in, and then we are going to provide them with the direct, in their home language, resources to how you access that at the school. So that's just the global piece, and then there's also the details of the team.
We have many existing opportunities. We have DHHS staff in all of our high schools, either in the wellness centers or in the Bridge to Wellness. We have staff members from DHHS and beyond in our cluster projects. We have our contracted work with Every Mind and Thrive Behavioral Health that is providing, counseling services in many of our middle and our high schools. And then we have working relationships with all of our agency partners in that we find ourselves very frequently in each other's spaces.
Right.
A couple of Wednesdays ago, there was an in-person mental health awareness week at Richard Montgomery, and if you went, you would see along that, what's the name of that street? Main Street. There are 12 to 15 agency partners there having resource tables. We had Dornay Hill from the Crisis Center with PPW Professional Learning on Friday. We had the Gilchrist Center in an event in October, and we are similarly going out to there. So there are both formal opportunities to engage through already established mechanisms, and then we're constantly trying to share information and really just provide updated information, because many times in our student well-being teams, it is a resource that's outside of the confines of MCPS that we are trying to engage with. So I mentioned warm handoffs, so we really tried. We have those relationships, so we're not just saying to a parent, here is a number, call them, they can help you. We're trying to make that connection.
Absolutely, and that infrastructure has been built over generations, which is phenomenal, but it's not working as well as it needs to. The numbers bear that out. So what I think, and Councilmember Mink, before this session started, mentioned the crossover to HHS, and she's absolutely correct. I think we also need to engage our Latino Health Initiative and our African American Health Program, because I think we have the opportunity now and additional resources through our Health Promotores program, but we have to change the paradigm in how we are thinking about this. It's no longer enough just to have that infrastructure. And I know everybody's overwhelmed and exhausted, and these touch points are significant, but I feel like we need, and we have, but the presentation you gave is excellent. And I think you all are controlling as much or more as you can, acknowledging there's a lot out of your control. So what I'd love to see as a follow-up to this session is a multi-pronged approach, because the truancy issue, obviously it's leading to catastrophic academic learning loss. We're seeing that in every imaginable way. But it won't be long, and it already is leading to other detrimental impacts on youth as well. We are, and I hate to say it, I don't want to sound like an alarmist, but I've been there and we're seeing it again. We're seeing a rise in gang activity. And it is unfortunately only a matter of time before the two are inextricably linked with very tragic circumstances. So this has to be, and I know it is, a high priority, but this is an instance like so many where the school system needs to be able to ask for help, and our sister organizations need to be able to provide it. So I know that we're going to have a briefing later this afternoon, serendipitously, on our out-of-school time programs and initiative. I know the Collaboration Council is working to bring the band back together again, but this should be one of the byproduct goals, a discernible benchmark goal that all of us are working towards achieving and lowering that absenteeism and truancy rate. So with that, I yield back to you, Mr. Chair.
Thank you. Couldn't agree more. Going down that path with the PPWs, this has to be a high priority for all the reasons stated. Councilmember Mink.
Thank you. This is a great conversation. Thank you all for the work that you're doing, and thank you to my colleagues for those great questions and points. I wanted to note how many variables are at play here, obviously on the causal side of students who are missing school, but also on the solution side. And that is, that's a good thing, because we want to do whatever we can that might have an impact, and we're seeing results. But it also can make it difficult to make decisions down the road about what exactly are the things that are working and what should we be funding up more. So I wanted to understand better how you're thinking about that, because let's say that we have extraordinary results, and at the end of the year we're like, everything we did is working great. There's no way that we can fund an expansion of all of these things fully in all of the schools. So how are you thinking about that? And I also wanted to note, in the slideshow, one of the partnership, the MCPS slideshow, one of the partnerships is with Attendance Works on the attendance communities of practice in 16 pilot schools, and I just wanted to better understand what exactly that was.
Yeah. So, certainly. I think, first and foremost, in looking at these pieces here, and thinking about. I'm sorry. Can you repeat the first question?
Yeah. So let me put them in the reverse order. One is just better understanding attendance communities of practice, and then the other is that is one of many tools. Yeah. How are we going to know what we should fund up the most?
Great. Thank you. Sorry, I lost myself with the attendance works there. So there's a couple pieces that we have. So this is something that's ongoing right now. So I'll start with internally, and then we'll have to think about externally as well. What we are tracking right now, primarily is through we have developed with our student information system like a digital multi-tier system of support. Any student that gets to a level 3 where they have ongoing, where they have this type of triaging, they're on a caseload of a PCC or a parent, pupil personnel worker, counselor, social worker, what have you, we are tracking the specific interventions over time to see if we are addressing whatever we are trying to solve. It may be attendance, it may be mental health, it could be any number of things. So we have built the system over the last couple of years. People have been trained. We're having every single administrator trained, I think, starting this week in every single school on how to use that, so we can track and say, when a student goes to a social worker, this is the success. When we have a student work with the folks in our student well-being team, street outreach network, our positive youth development specialists, we would note that in there and be able to track that over time. And this is where we are truly in a different space than we have been. It's like long time for academics, we could see, you're looking at numbers, grades. This is the kid's grade. We did this academic intervention. The grade goes up or grade goes down. This is not as easy to track, but we are using metrics, if you will, taken from the world of our psychologists as to how to monitor and assess growth over time. So that is one piece there. One thing that we need to do, which is we're just starting to do, is we look at who is seeing our social workers, who are seeing our bridge to wellness folks. We have the 2 contracts that were mentioned with Jessa and Thrive. We're serving 68 schools for therapeutic services that we had not previously. So we need to look at who's being seen, and if they're being seen for attendance specifically, is that attendance going in the right direction? That cross-referencing of data, right, that structure and process is literally in its infancy, but is absolutely where we're going. So we have one thing set up, specifically when a student gets to tier 3 in every school. We have to look at comparing our data as a school system outside of that one database.
So thank you, Ms. McGuire, for bringing up that slide. So none of those tiles there in and of themselves have a budget impact, but the truth is also that it takes staff members to do that.
Well, that's the budget impact.
Right, so that's where the budget impact is. And we've mentioned a lot about pupil personnel workers, and I'm very pleased by that. I couldn't be prouder of them. But it really is all of those staff members that I mentioned that are part of the student well-being team, all of those staff members and then some need to be involved if we're going to truly address chronic absenteeism. And I say and then some because I probably neglected to mention, some of the most important people is the teachers. I mean, the teachers have a significant role, not the least of which is taking accurate attendance, warmly greeting students who return after an absence, and also reaching out and saying, we missed Steve when he was in school. Is everything okay? Is there anything we can help with? Because Mr. Katz mentioned it when he was talking about the truancy prevention program. Some of the language that the student said is, when I learned that there was this person or group of people who cared, it made me want to come to school. And so we're also looking, the teachers are overwhelmed, but we're also looking at some very reasonable expectations of, just periodic outreach. We missed you. Because that's another thing that research has shown is that parents want to hear from their teachers. They may never have heard of the pupil personnel worker. They may or may not know their child's administrator or counselor. They knew who their child's teacher is. So they want to hear early on. And we need to provide support to teachers around how and when and give them time. And if they need scripts, really coach them on how to do that. And then specifically your attendance works question, it is a national organization who provides consultation to schools. Of course, the consultation has a budget price tag. So we have contracted with them to provide attendance communities of practice in 16 schools. So it's across 2 clusters, the elementary, middle, and high. And what it is in a nutshell is we had an in-person meeting in October. We are in the middle of virtual coaching calls at each of the individual 16 schools. And then there will be 3 more virtual professional learning meetings. And in between those are the individual school coaching calls. And then in addition, they are providing coaching and consultative support to a district team. And I can tell you, and they're fine with this, we are liberally using their materials and their concepts as we work with all of the other schools in our county.
Got it. Is that on ESSER funding? I think it's ESSER eligible. Is that,
I don't know where, I don't know where that has been budgeted from.
Is that something then that we can take the learning and the materials that we get from them and let it be done after this year, or is it something where that's another program we'd be potentially looking to expand the consulting opportunities?
It could be either or. So we absolutely have their permission as long as they're given credit to use their materials. But I've personally found some value just in the individual coaching and support. And so, that will be a discussion that we'll have is, do we want to expand this to 2 other clusters, or do we want to sort of take what we've learned and run with it? So we haven't made that decision yet.
Got it. Yeah, I think I'll just want to note back to what you said about the need to, or what Mr. Montalone noted about the need to compare the data that you're getting from all these different programs. That includes, like we've got some great data from the TPP results, right? So having the side-by-sides of all the different menu of options, we would love to fund everything to reach every single student, but that the reality is we just can't. And so the analysis that you all are going to be doing to decide where you're going to request funding for the most, we want to certainly be partners in making sure that we fully understand that well in advance of budget season, and also that the public is able to see the types of comparisons that you're doing to make those decisions as well will be really important. Relating to Councilmember Jawando's question about students missing 20 minutes of class here and there, and that adds up to a lot. There's also early dismissals, like students who leave early or are picked up early routinely. And so, those relate in that the question is about whether we're looking at like seat time as a way to gauge our attendance rates. Can you speak to that?
So from a high school standpoint, we don't look at seat time as it relates to grading and reporting. And as Mr. Monteleone mentioned, we are given sort of percentage bands from MSDE around, and it applies to period by period attendance as well as full day attendance. So there are percentages of presence in school that indicate you were there the entire day, you were there for a half day, or you weren't there at all, and that includes period by period. And then if it's period by period, if there are 7 days, those calculations factor in. And so, and this is what MSDE is working on, because the current model that we're working under came from the pandemic, and again, I believe it came from a position of grace, but right now, if you are present for 10% or more of a school day or a period up to 50%, you are considered a half-day present. And then if you are 51% or more present, again, in a period or in a school day, you're not absent at all. So in some of the examples that were given, a student could pick or choose missing 1 or 2 class periods in a day, and they could, in our student information system, in the way we officially calculate attendance, they could look like they have 0 absences. So that we're looking for some improved guidance from the state around that.
Got it. Thank you. Last note I'll make is that in the conversation that you just had with Councilmember Ludke about the secondary students and that difficult age range where some kids are not easy to control by the parents, and they may be able to drive, they can certainly get on the bus and make some decisions for themselves, which causes other difficulties, as we've discussed. And so I was really interested when you, Mr. Monteleone, when you got to your dream, right? And because where you went there was workforce, pipeline options, the ability for students to see how what they're learning now is going to impact their ability to do what they want to do later on, that there's a purpose to what they're doing. I think that also relates to the conversations you're having in Annapolis about the freedom to update what we mean when we talk about education and modernizing that. But I think that's a really, really critical point, because if that's your dream, then that really relates to a lot of other conversations that we've had about how to get in front of kids as young as middle school to make sure that they're starting to see that vision ahead of them and all the different opportunities that they may have. We shouldn't have somebody who's a sophomore in high school who doesn't know about the universities at Shady Grove. So that kind of thing. And so I think that this conversation really, really highlights the importance of all of us thinking about what we can do even as early as the middle school level to, and I know this is something that you're thinking about, but I just want to really draw that connection there to make sure that every single middle school student, we know that there are students who, by the time they enter kindergarten, they're like, I'm going to go to Columbia University like my parents, and they've got the t-shirts and the sweatshirts, and that's a very small percentage of kids. But every child deserves to have the vision that they can achieve and do any of these different things, and all those options are open to them. And so it's our job to make sure that as we have this captive audience, that they are all seeing that. And so the direct link here between absenteeism and truism and that is, I think, a really critical one. I don't know if you want, I just wanted to mention that. If you want to comment on that, feel free.
Yeah, I think so. The things that you're mentioning about as early as middle school, we are really grateful. Another area that I support and work with is our counseling and our college access team, right? And so we're really grateful for the expanding partnership with ACES right now, with the University of Shady Grove, right, with MC, with college tracks, with our dual enrollment. We are expanding ACES over the next phase is to get into middle schools in addition to expanding across more high schools. That's happening, right? We're going to have these different counselors and college counselors in addition come into our schools part-time through other partnerships. Where we potentially could add to that is with the workforce. Right? So we're real heavy on college access. Great thing. And the risk that you have here, right, and I'm just going to put it out there, some of the pushback on advocating workforce access and pipeline at an early age is the implicit and bias involved with those who are coaching students to go in one of two directions. Okay? So this is, it's not as, and I say that with the desire to open up both streams of access.
Right.
Okay? And even our most advanced intellectually developed students are questioning the value of college now. So we don't want to just say like, oh, 4 years of college, that's what everybody has to do. Yeah, that's great. Yes, absolutely. But we really should consider what that looks like. But it isn't just about putting a process in place and creating partnerships. It truly has to do with the professional development of those who are working with the students in the school because that could go awry very quickly, right? So I want to put that out there. We are always leading with those unintended consequences based on race and MCPS. So yes, and is how I would respond to that.
Totally agree with you. And I think, what we certainly don't want to do is end up saying like any kid who's the most likely to be truant or absenteeism, they're the kids who are going to be funneled into vocational programs simply because of that. That's not what we want. All options should be open to everyone. It's ensuring that everybody has an understanding that those options are open to them and we're going to help them achieve what they want to achieve. Thanks.
Thank you. Yep. And we have a workforce development conversation with MCPS, with the Economic Development Committee coming up. It's something I care about a lot. It's one of the reasons I started Summer Rise and all these other programs. And I know there is a MCPS strategy from even elementary school to expose kids to careers. So they're thinking about it, but it's something that's definitely connected to this conversation, as are so many other things. So just to wrap us up, and then we're going to move to our missing persons. I want to come back to this when you all have more to share, and if you could send the data that was requested, if you get updates on the policy change at the state level. I think you heard from several council members. We need to know what is the most impactful investments in this area as we head into budget. We know this is important, right? So so the question is, where are we getting our most bang for our buck? Is it PPWs and PCCs? I tend to think that's an area. Is it also this? Is it also that? What's the suite of things that you can handle, realizing you can't control everything, right? We're going to be working on the workforce development side. We're going to be working on the mentorship side. There's out of school time. There's other things that aren't in your control that we need to be doing to address this. But in your control, what are the things that you think are the highest value? I think that's something as a really direct follow-up talk with your colleagues and with the board we're going to want to hear. So really appreciate it, and we're going to thank you for all your work. So we'll transition to the next item. Thank you. And thank you to our police department members and Ms. Frog for hanging around. And we are eager to hear about the connectivity of missing persons here, particularly for our young people, but just in general. And so invite you all to come on down. want to say anything here?
Yeah, just,
Get into it.
yeah, let's get into it.
So, Ms. Farag, I will turn it over to you to tee us up so we can, if there's anything we need to know in advance, and then get into the discussion.
Yes, good morning, everyone. This briefing on missing persons is going to look at every population, but primarily about youth. Approximately 1,000 people go missing every year. By far, the vast majority of those are youth under 18. They make up about 800 or so missing persons each year. To date, there have been 829 missing youth this year. The department has a risk assessment form that is available for you to look at on Circle 14, and that basically goes through the unique circumstances of each person who's missing, determine what risk factors are, what the immediate need to deal with it, whether or not it might be a potential crime, and that determines how the department is going to investigate each person. In terms of youth, they did provide comprehensive demographic statistics on Circles 12 and 13 for your review. I just kind of encapsulated it. Approximately 46% of youth missing are Black, 32% are Hispanic, 20% are white only, and 2% are Asian. Different departments, different divisions within the department and different units approach these differently. And again, one of the bigger barriers is a lot of these are not crimes, so that limits how they are able to investigate and help find the person. There are special populations that require additional help or different approaches, including an increasing number of youth with autism, as well as an aging population that is more likely to have dementia as well. So I'm just going to turn it over to the department to go through how the different divisions and units address some of the barriers they have to investigation, as well as some of the underlying trends that they're seeing that might be contributing to particularly youth going missing.
Good morning. I introduce myself, Assistant Chief Nicholas Augustine. I'm the Chief of Investigative Services Bureau for Montgomery County Police. Joining me today to my left is Captain Mark Ermey, who is our Director of the Criminal Investigations Division. Their responsibility is for adult missing persons investigations within the first 72 hours. And to my right is Captain Jeff Bungie, who is our Director of Special Victims Investigative Division, which is investigating all of our youth missing person cases. As Ms. Farrat said, so far we have over 1,000 missing person cases MCPD has investigated. And these are unique cases. This is a responsibility of Montgomery County Police of doing a non-criminal investigation. A lot of our investigations involve criminal activity, but this is one of our responsibilities as non-criminal. And you'll hear this often from both captains here about how that limits our investigative resources and our ability to do an investigation, because it is not a criminal violation until we suspect foul play. And these are very resource intensive and very time sensitive investigations we must manage. But this is a collaborative effort, not only between the police department, but with the community, with the Department of Health and Human Services, MCPS, and the caregivers of our intellectually disabled community members. Our investigations range from child custody, abductions, runaways, those affected by intellectual disabilities, adults suffering from mental health, and missing persons with foul play suspected. So in looking at each of those situations, follow-up resources is needed, and they're different for each person. It's not like we can say this person needs the services of the crisis center or this person needs services of something else. Every situation is different. Every person is coming from a different background, whether diversity in the family or where they're coming from or how long they have been in our community. One important thing, especially dealing with our youth that runaways, is we need to break the cycle. Approximately 56% of our runaways are repeat runaways. This is a strain on not only the police department using resources, but it's a strain on the family. How many times does someone go missing and they say, well, the police aren't helping us anymore, so why even report it? So the numbers we have of runaways is the numbers that are reported to us. But at some point, they no longer respond to police. And I know we've had discussions in past years about youth homelessness, but how do we address that? What services do we have in Montgomery County for youth homelessness? Where can they go if they're in a family situation that is not safe for them? So first I'm going to turn it over to Captain Mark Ermey, who's going to talk about the investigative responsibility in looking at adult missing persons, and then Captain Bungie will speak about our juveniles. Thank you.
Good morning. I'm Captain Mark Ermey of the Criminal Investigations Division. So my division is unique because a majority of our investigations are criminal, but we are tasked with the responsibility of missing adults. Those missing adults can be non-critically factored missing adults, so those that just leave for whatever reason, and then also the critically factored adults where it takes more time and resources, immediate actions in attempt to locate the adult that's missing. So as Assistant Chief Augustine stated, my division is responsible for missing individuals that are 18 or older. And so those are the adults. Again, we break it up into the two. The missing persons, whenever we get a report, a lot of our reports will come in from patrol. So the information we gather is really patrol heavy on what they are able to obtain on the initial response. And that drives how we're going to respond. They will fill out the search urgency form to determine if there's any critical factors. They will have the reporting person, if they're reporting there's critical factors, they have to do an attestment form that allows that adult to be placed into NCIC so that they are listed as a critical missing individual. And basically the reporter is taking the onus, saying that they're swearing that there is some type of critical factor that needs police response immediately, which also goes with, putting out silver alerts and all that. So we basically will get notified if it's non-critically factored, we'll get the report, and our investigator will be signed. They start looking into what's going on. And they use in a range of different criteria. They're looking at, is there, recent family problems? Is there issues that they just, they're leaving for whatever reason? It could be stress at work, whatever. And we'll look at that. We'll start looking into, can we, are we able to get certain records that will help us identify maybe a location they're at. As stated, because these are non-criminal, it really hinders some of the things that we're legally allowed to do. We're generally not able to get subpoenas for bank records to see if they're using their bank card somewhere. They're withdrawing large amounts of money. Maybe search warrants for cell phones to try to track social media internally, to try to get text messages to see what's going on. So we're hindered a lot with the missing persons. And as I've said before, a person that is missing that's non-critically factored, if they want to go missing, they will go missing. They know. We've had individuals say, I knew not to use my phone. I knew not to post on social media. I knew not to withdraw money because of the fact that I knew that, one of my family members may have been able to log in and see where I'm at. So, generally, and with a missing person, one of our barriers is the understanding from those that are reporting them missing. With an adult, because they have the right to leave, they may got reported missing, but we generally will not tell the reporting person where they're at. There may be a reason why they've left. So we will make contact with a reporting person and say, hey, we have made contact with your loved one. We've instructed them to call you. But again, that's up to them if they're going to call you. Critically missing, those missing adults that are at risk, again, those are concerning because there's usually a reason. It could be they're suicidal. It could be that they have some type of disability, cognitive, intellectual, that is hindering them from making decisions. They're autistic and such. And we want to put our resources immediately to that. And again, that's where that search urgency really helps us. And we partner with our search manager from our special operations division. They're notified. They're trained in knowing search operations, knowing how far people can travel in a certain amount of time from when they're reported and all that. So we'll partner with them immediately to identify what the best option is to try to locate those individuals. We immediately get out our press releases. We will go out and assist patrol in doing, searches in perimeters and such, coordinate with SOD for use of the drone if need be to look in, wooded areas or bodies of water where autistic individuals are prone to be drawn to ensure that we are searching, as much as we can and giving the attention we can. We start looking at what we can gather about the individual. In an effort, we notify, the metro system, Parks and Recs, or whoever, the information we can gather on where they're likely to be, is how we really handle a lot of the missing at risk. After 72 hours, they do get transferred over. And it's usually 72 hours of us working it. Not that it's reported on Friday and on Sunday or Monday we're like, 72 hours, we're passing it on. We work it for 72 hours. And again, depending on the level, if it's just a regular missing person or a missing at risk, we may be working through the weekend. We may be working through all hours of the day trying to locate these individuals. So that's generally, and once it transfers, it goes over to our cold case unit because they have that time they could dedicate to that specific incident, where unfortunately our investigators are also investigating, criminal activity that may have just occurred. So the department does have a process where we can still give that full time and attention and not just let it go by the wayside because we get, pulled into another investigation. So generally that's how we handle. As the chief said, missing adults is not as many a year as juveniles. This year alone, I believe we've had around 230. And we do have a closure rate hovering around 87 to 90% of locating individuals. And generally we'll locate them, within the first day or so, if not hours. We just had a couple last night. Within an hour, we were able to locate the individual. So generally, we're able to locate pretty quick. But again, the two most important parts is that, if a person wants to go missing, especially an adult, it's going to be tough to find them. We rely heavily on the community. We rely heavily on our postings to get people to recognize and report that they may have seen the individual. So.
Thank you very much. Yeah, and I was going to ask that. Looks like about 80%, 800 plus so are youth. So good transition to your work.
Good morning. Captain Jeff Bungie with the Special Victims Investigations Division. My team consists of a sergeant and 4 investigators that are responsible for locating all of our youth that have either gone missing or have run away. I'm happy to report as of Friday, just slightly updated numbers from when we did the packet. We were up to 936 missing children reports in Montgomery County year to date. We have returned and recovered 921 of those, which leaves 15 that are outstanding. Of those 15, 9 of them are less than 30 days that they have been missing, and we have 6 cases that we have open which are beyond 30 days. And I'm happy to discuss those, the circumstances of those 6 cases if you would like. Of the 936 cases, 71% or 665 of those actually have been assigned to investigators, meaning the rest of those cases have been closed out by patrol. Mom, dad calls, says my child has run away. The child is found before it gets assigned to an investigator. They still come to my division to get looked at to make sure the appropriate closure has taken place, that they've been removed from NCIC. So my team looks at all 936, but of those, 665 have actually been assigned to the investigators for this year. When we begin a runaway or a missing child case, it's traditional police work, as Captain Ermey spoke about. My team is very good at getting out and pounding the pavement, if you will, getting out on foot, posting flyers. This team of 4 investigators, they're dedicated to finding these runaways, whereas Captain Ermey's folks, they have the adult missing plus all the other criminal events. So my team is very good. They're excellent at getting out, pounding the pavement. We work with our public information office to put out flyers, social media, our website. We work with the National Center for Missing and Exploited Children. We work with other not-for-profit organizations, all to bring these children home. Most of these children are located fairly quickly. As I said, the numbers are only 15 that are outstanding right now, which because of that, it's a 98.3% closure rate. So we're very pleased with that number. 98.3% of the children that have gone missing have come back. I believe there's one of the 6 beyond 30 days that spans back to 2022. Otherwise, every reported child that's been missing prior to this year has been recovered and brought home. Again, we use all the traditional investigative methods. We work very closely with the community engagement officers. They're our pipeline to the schools. They're our pipeline to friends of the children that have gone missing. We utilize, as best we can, friends of the children who have gone missing. Hey, can you please text your friend? Let them know that they're not in trouble. We just want to make sure that they're okay. We want to bring them home. So we utilize that very frequently. When we do find these kids, we do the best that we can to debrief them and try and figure out where they were, what they've been up to. You know, a lot of times they don't want to tell us. Sometimes that they will. I've only been in this division since March, and I'm extremely impressed with the work that these 4 detectives and the sergeant do. They have actually created bonds with a lot of these runaways where, hey, listen, we don't want you to run away again, but if you do, here's my number. Call me, text me, let me know so that at least I have contact with you. We can tell your parents, hey, you know, little Johnny has reached out. We know that they've run away. We're going to do what we can to bring them home to you, but they've at least reached out. They've formed a lot of bond and a lot of connection with a lot of these runaways, and it's been very impressive. The repeat runaways, as the assistant chief said, at least half of what we're dealing with are repeat runaways. And then a lot of this goes into why are the kids running away, and if there's anything that we can do to prevent that. And you know, as a police department, as I said, these detectives, they really try to take time as best they can. Again, there's 4 of them dealing with over 600 assigned cases. They don't get to take a tremendous amount of time to do a real deep dive into why or where the children have been. But when they do, we have the vast majority of what we have with runaways are what we traditionally think is a runaway. Some type of family issue, whether it's, you know, an argument with mom or dad. You need to go to school tomorrow. I don't want to go to school. They run away. Blossoming romantic relationships between kids, and they want to go out on a date, and mom and dad don't want that. So that's primarily what we have. We don't have a lot of the nefarious activity. We don't have kidnappings. We don't have a lot of movie type things that go on. There's lots of talk. We had a case over the summer that I believe you're all aware of. There was a 15-year-old that went missing for, I think she was gone for 41 days. When we spoke to her, our detective spoke to her, she's exactly what Captain Ermey said. I knew that you'd be looking at my social media. I knew that if I used I believe she did have some sort of debit card. I knew that if I used my phone, well, actually, she didn't have her phone with her. I didn't want to be found. You know, while a private family matter, those are the things that we're being presented with. So, like I said, our team does a tremendous job in finding these folks. I'm extremely proud of the work that they do every single day. We were lucky. We had a reporter from Fox 5 that rode along with 2 of our runaway detectives a couple months ago and really highlighted the work that they're doing out there and trying to find these kids. So that's kind of where we are, and I'm happy to answer any other questions you may have.
And just one thing while we're talking on our special victims, and a thing that concerns me to talk about underreporting. Of those 6 cases that have been over 30 days, 3 of them have been unaccompanied minors that have been reported. I am sure there's a lot more missing unaccompanied minors out there that have not been reported to us. That one case from 2022 is an unaccompanied minor. And they often leave very quickly with little footprint in Montgomery County. And whether they're being reported to us or not, that is a major concern that affects all of our divisions, whether we're looking at human trafficking or anything like that, is getting the information out to our community and knowing where our youth are and what our youth are doing and what services. Often, we want to provide the families with resources, and we always say, kind of like with the police department, hey, if anything's going on, call 911 or call the police. I feel we have gotten into that way of saying, hey, if you need services, call the crisis center. We need to look beyond that and say, the crisis center is great and has resources, but what other resources are available in our community? What nonprofit organizations? Because each one of these situations is it's different. And can the crisis center handle getting 800 cases for runaways and repeat runaways? We need to look broader at that, and Special Victims is working on getting a pamphlet produced to provide those resources to parents on what other resources are in our community. And that's the next big step we need to take, because one organization is not going to be able to handle all the needs we have for our juveniles that are running away and going missing.
Yeah, appreciate that. I'll turn to colleagues here. The underreporting and who has access is always an issue, right? Who has access to, and who feels comfortable, who's going to be understood language-wise. Like, there's a ton of issues embedded in this. And then what resources are available, right? To your last point, I think we are going to need to follow up with this conversation with the Crisis Center and our drop-in center. With one of the questions I had, we'll talk about them. What's happening with that, if anything? How is the connection handoff happening? You're right. No one organization can handle it, but you guys are clearly doing really good work. I'm going to defer my questions to colleagues, and then I'll come back at the end if they're not asked. So I'll go first to Councilmember Katz, Co-Chair Katz.
Thank you very much. First off, thank you, Ms. Frog, for the packet. I always like to remember to do that because it's obviously a big help to us to have a good packet. And also to you all for doing the work. Everybody feels like that they're an expert on this because they look at Law and Order or whatever, and therefore, that's where you get that's where everybody gets their law degree. But if a person who is 15 years old, if the parent reports that person to be missing, and it's not criminal, I'm assuming. But does the parent have any authority over that 15-year-old? How does that work?
So when the parents report the juvenile missing, it comes to us and we begin the investigation. The hurdle, as we've talked about, are what sort of legal demands that we can acquire to assist us in our investigation. A subpoena being the lowest of the three that I would consider for a missing child investigation. Even if we get to the threshold of getting a subpoena, which requires the least amount of criminality or things along those lines, a subpoena doesn't get us very much. What helps us in our investigations when it does get to that criminal level is being able to look at somebody's cell phone or their text messages, and that doesn't come in a legal demand until we get towards the search warrant level. So that's the biggest problem for us. And even with parents telling us, hey, our kid's missing, if they're able to, like in that case from the summer, the parent was able to turn the phone over to us, and we were able to get into that phone and look at, and that helped us to some degree. But again, this child did not want to be found and was doing nothing social media-wise. So the parent can turn over a phone, and we can search the phone, and we can go through that, and that assists us. But just because somebody's 15, we have to deal with the phone providers or with Apple or with Meta or with Facebook and Instagram. So in order for us to get stuff from them, unless there's something exigent or criminal in nature, even if a parent reports it, it doesn't greatly assist us.
And so and we talk about the homelessness. If that young person who's 15, we're going to stick with a 15-year-old here, if that 15-year-old decides to go to one of the drop-in centers in Wheaton or wherever, do they avoid going there so that they won't be found? How does that work? How does that?
So I'll address this. One of the 6 that we currently have as an over 30-day case, that juvenile is also wanted by our major crimes division. So that juvenile does not want to be found.
Right.
So that's an example. The drop-in center, as I understand it, as posted on their website, their services are offered for 16 to 24-year-olds. And we have a lot of our runaways that are under 16. So I don't know how we make that change.
Right.
I would love for that to happen, to be able to provide more services under the age of 16. But I wouldn't say that they would avoid going to those places once we've located them. I don't think that that's the case.
Well, then we should, the chair of HHS happens to be sitting here. We should certainly follow up on below the 16-year-olds, what we're doing and how we can do a better job. And then the last thing, and one of the discussion questions that Ms. Farag came up with, is about the drone technology. And of course, we just had a major discussion about drones, DFR, the drones as a first responder. But how effective are the drones, and especially in parks or other places?
Right. So far, year to date, the drones have been used in 17 cases of missing person. We have to, understand the limitations of the drones. Another factor is how long the person has been missing. Now, if this is a critical adult that has intellectual disabilities, and depending on where they went missing and last seen and time frame, or managed search operations can do some math and mapping and try to determine what area they're in, and drones would be beneficial on that. But again, there are limitations with that. I know, as well as there is limitations with, some people talk about silver alerts, and we have to look at silver alerts. In Maryland, the only authorization for a silver alert is if you're in a vehicle. Where other states have different, they don't require a vehicle to be part of a silver alert, and also don't have an age requirement. But they send those text messages that you get in the middle of the night where your phone goes off and makes that sound. They have a picture. In Maryland, we can't do that. We just have the silver alert for people in a vehicle. So there's limitations with that with state law, but looking at drones, we have the ability to do it, but it also depends on their individual circumstances. And so far this year, there's been 17 cases where they have been beneficial.
Again, thank you for doing it. There's so much misinformation out there about when someone goes missing. Everybody figure, and to your point earlier that they weren't doing anything for me. Well, you were doing plenty, but to that person whose child is no longer at home, it hurt. They felt that you weren't doing. But anyhow, thank you very much, and I'll turn it back.
Thank you, and to hear those high percentage rates of children, I think you said 936, 921 have been located. That's, any child being missing is obviously, it's one of the scariest things as a parent, but that's a really impressive rate. Councilmember Albanos.
Thank you. So about a year ago, I asked Ms. Farag about this because I'm on your email distribution list. I know all of us are. And so I'm always struck by when I get an email saying concern for missing so-and-so. Those used to happen a couple times a week. There were 3 instances in the last 2 weeks in which there were 3 in one day. And so it tracks with the numbers you all are seeing, and it's concerning, obviously, that there are only 4 officers dedicated to this, acknowledging they leverage their resources, work with a lot of other officers and organizations. But the trend is concerning because although the great news is that in the vast majority of cases, we are closing those cases, the underlying issues that are leading to them leaving in the first place remain. And you can draw a straight line between the rise in substance abuse behavior and some of the issues that we are seeing. And concern for missing 15-year-old, concern for missing 14-year-old, concern for missing 12-year-old. I remember one instance in which there was concern for missing 9-year-old. And so it's part of a broader systemic issue that the enforcement and working with you all to help close these cases is a really, and obviously the most important part of this story. But addressing the underlying issues that's leading to the runaway situation and to begin with is obviously something that we're going to have to follow up on and see what more we can do. But I did have a couple of questions. So, and by the way, I meant to say this. There was also a high-profile case just a couple of weeks ago in which a gentleman with a developmental learning disability was found by MCPD. He had been in a metro station in one of the rooms, and I was incredibly impressed with how you all addressed that, and just to see the relief that was brought to his family was really remarkable. So that was obviously one of the success stories. But how are parents engaged? And who are more often than not the people reporting the missing child? I assume it's the parents, but we just had a conversation about chronically truant children. Who else can report these missing cases, and who's reporting them?
That's a good question. Predominantly, it's the parent or the guardian that's reporting the juvenile to us. I'm not aware of other instances. Sometimes we'll get a call to a school where they saw a student that left the campus, or a student that has a developmental disability that's walked away from the campus. So it could be a school in that regard, but the vast majority of the time it's a parent or guardian. And as you can imagine, we have a range of concern. We get parents that will contact us and not be very engaged. They've reported to us. And then we have the other extreme where a parent is demanding hourly updates from us, which we're happy to give those updates. That's at my level where I would kind of handle that, so my investigators can do their investigating, and anything in between. But parent or guardian is typically who is reporting to us.
You mentioned also, and I completely agree with you, that it's often peers, friends that are in the best position to be able to help identify a friend that's been lost, and that connection, that partnership. Can you talk a little bit about your partnership with MCPS and what that collaboration looks like? You mentioned the obviously, I forgot what they're called now, but the officers who are responsible for covering school beats. But in addition to that, security personnel, other staff, other administrators, I mean, everybody has often some piece of information. What does that engagement look like?
With regard to runaways and missing children and things like, MCPS has been very helpful. Again, like you said, security guards, they have the pulse of what's going on in that school better probably than anybody. And they're very helpful for us to identify, oh, John is a friend with these three people over here. These are the three other students you want to talk to that might have information for you. So MCPS administration has been helpful in getting us requests when we identify, or if we have a social media post or a picture of our missing with other children, we're able to go to the school and say, hey, who are these other kids, and can we chat with them? And they've been very helpful to us.
I just, again, this is anecdotal, just based on the emails that I get, but I've noticed a trend that younger children are entering into the fray. Is that accurate, or is it been pretty consistent across youth from different ages?
There may be a lowering of the age. I wouldn't say it's significant at this point. I don't have the data to do the break, although it might be in the back of the packet, the breakdown on age. I'd have to look. But I agree that if I'm not at the office and I get the alert, every time I see an alert, lately I've seen, and the one that sticks out, like you said, was the 9-year-old. And when I got that alert, I was making phone calls right away. And thankfully that 9-year-old was located. But I do see a little bit of lowering of that age, but I don't know that it's substantial.
And do you think there's an opportunity proactively? I mean, I don't want to, again, overcompensate, but is there a way that we can educate families, particularly if we are seeing disproportionately from certain zip codes or certain areas or certain demographics that are being impacted by this? Is there an opportunity for us to be proactive in letting parents or guardians know what to do in the event that their child, has been reported missing, what steps they can take, what we can do further upstream to prevent them from going missing in the first place?
So one of the things I was thankful for was actually that Fox 5 piece that was done, because they talked to our detectives, Detective Witherspoon and Detective Allen, and they got some good insight. And one of the things that Detective Witherspoon said is oftentimes the first thing that a parent will do to discipline their child is take their phone from them. And that puts us at a disadvantage when we try to find a child. Not that we're in a position to tell people how they should parent their children, but that's a significant thing for us. But we do presentations. One of our primary presentations, and we don't have a tremendous amount of these cases, few, and I'm thankful, are where children would get lured online. And we have a detective that does a very in-depth presentation. He's done several to PTA meetings, faith-based groups, on the dangers of online internet, things of that nature. But we're happy to do presentations for folks to discuss. We talk about, make sure you know who your kids' friends are.
Mm-hmm.
Make sure that your children, as those ages get younger, know their name, their address, and things like that, so that if they do get lost, if that's what this is, that they can help out and help themselves out. But overall, we're ready and available to anybody that wants to listen. We have some prevention tips. We have things that we can discuss at schools, churches, synagogues. Anybody that wants to listen, we'll be happy to give presentations.
Great. Thank you. I yield back to you, Mr. Chair.
Thank you. Councilmember Make?
Thank you. I'm so glad that we're having this session today, and thank you all for the work that you're doing. As Councilmember Albanese mentioned, the barrage of press releases have been really concerning, and thank you to Ms. Farag. We had reached out as well to ask about that. So appreciate your work, and glad that we're talking about it, and I think that the connection also with our previous session obviously is it's very relevant there, the intersection, and so on following up on Councilmember Albanese's line of questioning about the connection with MCPS, I'm just wondering if there's anything else that we can do there to help leverage the partnership. I know you all have a great relationship there, but are there like systemic things in place when you have a repeat runaway, MCPS gets a flag from you and they do X, Y, and Z? Is there anything like that kind of systemically in place?
Not currently, besides working with them, because the thing with repeat runaways is they need to be present to get the help they need. And we talk about child in need of supervision and programs like that where they're voluntary programs. If we have a repeat runaway, how are we going to ensure that they're getting the services? Most likely the school system is notified of it, but we also have to respect the privacy of the family and how much information they want to be given out and so on, because we run issues with that through social media postings and so on about juveniles information being exposed out there online when they're missing in return. But with the current partnership we have, it goes well in getting information and working with our school resource officers, our principals, our the security staff there at the school to get information. They most likely give us information to tell us what's going on in that child's current situation at school. But and one thing I look over here is, during this summer, we consistently had 8 to 10 runaways that were using fentanyl. And how is that affecting a different dynamic in the way we investigate runaways? Right. This is not the typical, hey, I'm upset at mom and dad. No, I'm going to go get high and go use fentanyl, which is even more of a crisis with a medical situation with overdoses and so on. So it's really partnering with MCPS to get the message out and the trends we're seeing and why juveniles are leaving the home and going out and what it is, because it's totally different than 10 years ago when we had runaways. Yes, people were upset. Totally different dynamic now on why people are leaving. But working with the school system and our other partners is a priority of ours, but making sure we get the right message out and how we can prevent it and share that information together.
Yeah. I thought it was a very good point that we saw that we see in the packet from you all, that a major issue is that we don't have enough resources to connect families to once you find the kids and the families are reunited. And it's concerning, as flagged, that the crisis center, which should be a resource and which you all have turned to as a resource, you have heard from families that they have already reached out to the crisis center, and obviously that didn't solve the problem because then it ended up in your hands. So that's, as noted, something that we need to follow up on. But also, the crisis center is overburdened, and that probably has something to do with it, and we just need more resources. We certainly have heard the desperation from parents in regards to the fentanyl, that if the kids don't want to get treatment, we don't really have anywhere for them to turn to. Or if the kids are in treatment and then they fall off the horse, then they lose access to some of those educational opportunities that they were able to access while they were sober. So that we are just missing huge parts of the infrastructure that we need to be able to prevent these repeats from continuing to happen, it seems like. In your conversations with MCPS, when you're talking about the youth runaways and especially some of the repeats, if it makes sense to loop in, say, the Street Outreach Network or some other resource, is it generally, who does that? Would that be you all or would that be MCPS?
So I think it's collaborative depending on the circumstances. We have a partnership with the Street Outreach Network for those youths that are considered at risk that would benefit from that program. But SVID does referrals now and then and determine the current situation and what that youth is involved in. But we also want the family to be involved in this too, because we can make a referral, but if the family's not on board to take them to get help with the services there, where is that going to fall on? So it's really collaborating with what we see in the police department, and when we debrief the juvenile and recommending those services to make sure the family's on board to get that help. But if MCPS is seeing certain things that they're noticing in the school setting, if the child is going to school, what resources they can make that referral to that may be able to assist better with their certain educational aspects.
Got it. Yeah, it'd be great to be able to get some more detailed data on like what services have been offered to, especially these most at-risk kids, these repeat kids, but what's been offered to them, and then has the family said no, or who's doing the referring, and then what seems like it worked. Maybe they took advantage of the resources and now they're not a repeat case again, so that we can know where to focus our efforts. That would be great, and that's on MCPS as well as you all. On the question about the Rashawn Williams case, who was the adult who went missing just recently and was found at a metro station. Just was curious if there were any hindrances in dealing with WMATA or the WMATA police, or whether that was if there's any. I know that you all work together obviously on a lot of different things, but I think that there was a number of days where you all were trying to get access to video, and it would have been helpful for you all to have that sooner. Are there any improvements that could be made there?
Yeah, so in that investigation, first and foremost, they're a great partner to work with. We work with them regularly on missing individuals, especially with the public transportation systems in the area. Those are some of the first individuals we contact to pass on the information, and we did in this case as well. They were helpful. They went and looked at the stations that we told them that the individual was in the past known to visit, so they were there. The video situation, generally speaking, it does take some time for them to get videos downloaded, made, and get to us. But what I'll say in this case is my 3rd district and investigative sergeant was immediately on the phone with them, and they were actually very helpful of getting the videos as quick as possible to us. So I would not say it was they were a hindrance in that. They actually sped the process up for us.
Or not necessarily that they were a hindrance, but any logistical.
The process itself.
Exactly.
Yeah, the process itself. They have their policies in that, but they were actually very willing to work with the detective sergeant in that case to get video as quick as possible downloaded into us so that we could review and share and such.
So that's about as good as it's going to get.
Yeah, and that's just, and that's, and I will say in that investigation, I mean, it started with the 3rd District investigative sections after being notified by patrol. And we were, in contact with our search manager. The on-call detective was working on that Saturday and Sunday. They were reviewing stuff. They were in communication with Prince George's County, who was also looking at different areas that he was known to visit in the past. So he was, my on-call detective was in regular contact there, and then, continued throughout. They worked collaboratively with cold case that, were briefed and came into the investigation. And, I believe the transition was pretty smooth. And unfortunately, there are situations where, in some cases, the public expectation is we're going to find them immediately. And unfortunately, there's sometimes we don't. But I will say that we don't give up. And we didn't give up in this situation. We worked, several days to find the individual. There was multiple calls where there was possible sightings, and the department put resources, not one or two officers, they put resources into that area of the possible, sighting that we received from the public, which that's the goal when we get the public information out, is we want that collaboration with the public. We want them to be notifying. I look at Captain Bunge's case. I was actually acting at that time, and one of the things we were talking about when we were looking at his case over the summer, getting that information out, and it was an alert security guard at a mall in Baltimore that recognized the juvenile that was missing and made notifications, and that's that collaboration. But yeah, in that case, Metro was good, and I thought we worked well together to get to the end result of bringing Mr. Williams home.
Great, thank you. The Autism, IDD, Alzheimer's, and Dementia Unit has a staffing issue, of course, as so many of our units do now. Are there, with that one in particular, wondering if it would be helpful or possible to address some of that shortage with civilianization, not to replace existing officers or prevent the hiring of sworn officers, but as we look at ways that we can, expand our reach, is that something that would be helpful to consider?
I think it is something to consider, and as long as we can figure out a job description, write up what that responsibility will be, because it doesn't need to be a sworn person to provide resources to families and understand how they can better protect those that do go missing. So it is something to explore and to look at and see how we can have a position that encompasses, in addition to the people that we already have there, and being a liaison to the family as well as many of the nonprofit resources for that community, and getting that together. But it is something to explore and see how we can incorporate more into that unit.
Great. And then last, to circle back quickly before I turn it back over, on the MCPS and the youth runaway data collection, are those data points that exist right now? Like if an officer suggests to a family, how about connecting with the Street Outreach Network or this or that, and then the family says either yes or no, is that currently recorded anywhere? And if not, is that something that would be doable?
I don't believe that that's recorded right now, to my knowledge, and we can certainly look into that. Absolutely.
Yeah, that could be helpful, because the over half as repeats is, if we could knock that off of your workload, that would be hugely helpful if we can save those families from that trauma. And so if we can get data about what's working and what's not working, that could be really helpful down the line.
Yeah, and I think every time a detective reunites a runaway with the family, they're suggesting resources out there.
Right.
It's not that, but they're saying, hey, the crisis center is out here. I even know patrol officers that reunited juveniles back, saying, hey, there's resources out here, contact the crisis center. And that's what I was saying, is we can't always say contact the crisis center, because everyone's situation is differently, and that's why we really need to have a list of resources, both nonprofit and government resources, that we can provide to families out there to get timely services.
Right. Thank you.
Yeah, that seems to be like a highlight that I had noticed, that when I worked as an AmeriCorps member with MCPD, when there used to be that relationship, one of my jobs was to follow up with victims of crimes and offer assistance for victims of crimes, like the nonprofit. So it was clearly like, it was not I was employed by the federal government to work there, but to Councilmember Mink's point, whether it's civilian or some other thing, getting resources to families quickly, and comprehensive resources that might be outside the level of expertise of the department even, I think that's something that we're hearing when we hear from these long cold cases from constituents about who are clearly distraught. That's one of the things that kind of bubbles up. Councilmember Lukey.
Thank you. I noticed you were talking about earlier a good chunk of cases, about a third of them end up being resolved by patrol officers fairly quickly. And so, for example, I think it was yesterday, there was an alert that went out around 5:30 in the morning for a missing 87-year-old who was cognitively impaired, and the alert went out that they'd been found unharmed within 3 hours. And I'm assuming that that's one of those ones, because of the cognitive impairment and the age of the individual involved, where it was deemed critical, right? And I think, though yesterday was a very long day, on my way to the Bay Bridge to do a race, there was a highway alert sign that also advised of the alert. So can you talk about when you get those in and you're making a distinction between critical versus non-critical, how quickly it takes from time of call to service to time of deploying these alert resources, whether it's the highway signs, the NCR watch, et cetera? How long does that take?
Sure. So we get the initial information through the 911 call that comes in, and it's immediately prioritized. If it's a critical missing, it's higher elevated to be dispatched compared to a non-critical missing. So the patrol officers get that information right away to have a quicker response to this. When an officer gets there and gets the initial information, they have to notify their supervisor if this is a critical missing situation and immediately notify one of our criminal investigators. Now, with the Silver Alert program, the program is run by the state and has actual requirements for that. So the detective looks at it and see if it meets that situation. In Maryland, the person at least has to be 60 years of age. So if we're dealing with someone that's 21 years of age, even if they have a cognitive disability, they don't they don't meet that criteria. So immediately when the detectives immediately go and notify our PIO to get the social media postings out. We have now standardized our what each one looks like, so a detective can put the picture there, get all the information, so it's standardized, it doesn't deviate from other posts, and immediately get that out there on social media, and then our PIO will work with sending that out to the press and media resources. So it's relatively quick. I would say within an hour of getting the initial call, if we determine that this is a critical missing, all those notifications are being made through our search managers for them to start out that way if they feel they're going to be viable. Or if the person is on mass transit, making the notifications to Metro as well as Ride-On. So it's a very quick aspect of making all those notifications. Our detectives are on call on the weekends to handle these as well as assist, and whether if a Silver Alert is needed, they're very quick to notify the MSP desk, and they put out the Silver Alert as long as it is meeting their criteria for that alert.
And then in terms of the ones that come out over the NCR watch distro lists, right? Is there a specific criteria that the NCR watch has for what does or doesn't get included in those when it comes to missing persons?
So when those come out, what we usually do is we'll coordinate with MCAC, and MCAC will put, so when we look at a critical like Mr. Williams, we contacted MCAC and they added. So we give that information to them and they make the determination if they're going to announce it. But I will say for his case, it was, by the time the detective was notified, it was only about 15 minutes and we had the press release already out.
Right.
You know, we work with our different state partners, depending on the situation, to get that additional information out.
And that would be on the MD watch, the MCAC's distro list.
Yeah,
Then in terms of the other one, the NCR watch, which is cross state.
Yes.
So it's
they usually handle that. They'll usually handle that stuff for us as well.
Okay, so they get it over to.
Yeah, they'll send it over to a fusion center or such in the other states because they have contact with all them and they do all the information sharing. So that's really our clearinghouse when it comes to getting notifications out to other states and such, outside of putting somebody in the NCIC.
Right,
but, yeah, they'll usually handle a lot of that for us because they have that distribution list. They can just blast it. So,
So for the 2/3 of other cases that end up going to a detective, to an investigator, do you have any sense of what percentage of those involve other ongoing issues, whether it be a human trafficking type issue, child abuse or neglect type issue, gang involvement? Do you have any idea of what percentage of that other 2/3 that might apply to?
To give an actual percentage, I can't give you a percentage, but the sergeant of the missing children unit, he said that to date, there was one case, and it was an over 30-day case that recently resolved about 3 weeks ago. We had indications that there might be human trafficking going on there, but when she came home, the mom, we've been in constant contact with mom. We tried to debrief, and she's not telling us anything that can give us any conclusive evidence that there was trafficking. We don't have cases that if you've seen the movie about the human trafficking, where our juveniles tend to get involved in that type of behavior is when they go missing for a while and they don't have money and they don't have any. They resort to that type of behavior. We've not in 2023. I checked with my sergeant a little while ago, and he said we don't have any for this year that we're aware of that are human trafficking. So, as far as giving an exact statistical number, I don't have that for you.
So we have missing, we have no missing children where there's a human trafficking issue. We separately have other human trafficking issues that may involve children, but they were not children who had gone missing that would have been under the purview of your division. Is that right?
No, I don't know that we had. I'm not aware of any children that have been victims of human trafficking for at least 2023.
Okay. Okay.
Yeah, I think a majority of our runaways are running away due to family issues or stuff going on in the home. Yes, there's some that may be due to gang activity, but what I've experienced in the past, seen in the past, ones that are going to go for gang activities because they are not getting the connection in the home, and they are looking for unaccompanied minors and so on. They don't have that connection with anyone else, and they're getting recruited, which we had a severe issue in the schools several years ago, gang members getting recruited in there and leaving to get the connection with a different type of a family setting. So a majority of ours are issues going on in the home and disputes and so on.
And I know, one of the concerns is and we talked about this in our prior hearing, we've talked about it in other hearings, with the child in need of supervision process, which I know is not so much deployed by the Department of Juvenile Services. But even if an order is granted, those orders are non-enforceable. Is that correct?
That's correct.
So any recommendations that the court is making for services that the child needs are wholly voluntary, right?
Correct.
Right.
And timeliness is a thing for needed of the resources.
True.
Waiting 3 to 6 months for a repeat runaway to get services is not the ideal thing. It needs to be timely and immediate to get the services going and have follow-up.
Yes. And do you have any sense, again, given the numbers, particularly of adolescents, where this is happening, where it's not an IDD-related issue, how many of them are needing mental and behavioral health interventions and unable to access it due to lack of care in the state? Yes.
I would probably say a majority of our runaways, because they're not IDD, a lot of them are not IDD related.
Right.
I would probably say a majority to determine what services they need to be better assessed to determine what other services they need in mental health.
Right, but I'm talking about even where it's been determined they need services, are they not able to access them?
I can't.
If you know, you may not know.
I don't know.
Okay.
I couldn't answer that. Again, what my investigators tell me time and again is, we have a list of resources that we will provide, and on these repeat runaways, we say, have you done this, and they say yes, and we haven't found that one magic resource or several resources that have been able to help these repeat runaways.
And then I know there was some discussion through my colleagues' questioning about, sometimes the person who's most able to access or know that something is wrong and who does report is a friend of a young person who, they noticed their friend had been down in mood, had been talking about certain things, had been voicing concerns at home, and then doesn't show up for school for a while. And we do have an anonymous reporting system for that all the students can use, parents can use, teachers can use. And that works by, once that comes in, and that's 24/7, then within our county, Captain Satinsky would get the notification because he oversees the CEO program within MCP. once that happens, if it's suspected that this is a missing person, does that then get referred to your unit?
It would. If it's a juvenile, that would. I'm not aware of any that we've gotten via that mean.
Right. And if it's a suspected mental health crisis that's leading to the disappearance of the person or not being able to access them, does MCP get involved with the school system on collaborating for how to intervene?
On how to on locating them, or
Locating and then intervention.
locating primarily comes to us to be able to locate. And again, we work closely with the school, the CEOs. But as far as collaborating to get them additional services, again, I don't know if we determine that there's a mental health issue. I don't know what we're able to provide to the schools as far as there being a mental health issue.
And we're limited in how much we can partner with MCPS in providing intervention and working with them collaboratively to get resources. They may know of it, but we also have to respect the MOU and how we intervene in that aspect of that if we are brought into that picture.
But that would be if the school is bringing you into something inside the school, but if you're locating the adolescent in the community and they have acute behavioral health needs, you have the authority to intervene at that time.
Oh, yes, exactly.
Right. Okay. I
think
that's it.
Yeah, awesome.
Yeah.
Thank you. There you go. Did you go ahead?
Potential resource. I don't know if you all currently refer people to the Conflict Resolution Center of Montgomery County, but they offer free mediation and conflict resolution services to anyone who lives, works, attends school, or volunteers in Montgomery County. So that is a resource for parents and kids as well as other iterations of that. And they also work with MCPS, but that's one potential.
And they've asked us for more. They've asked for more referrals, actually.
Yeah.
Thank you all very much. I know you got a meeting, Captain Augustine, and I have to give my committee lunch opportunity before we're back here at 1:30 for a different committee. Really appreciate the information, the follow-up, and we'll, again, come back to this. But the thinking about what, as we head into, I think you got some good ideas here, the civilian idea, the resources, other state law changes. I say this to every committee that we've been in front of as we go through our state legislative process. You mentioned the silver alert. You mentioned some of the things you are or are not allowed to do that might be pretty small fixes that we could help advocate for. Those fixes make sense to me. I always wondered why we didn't have pictures and why it was I always wondered those things. I didn't know until I looked into it that it was state law. So let us know if those are, and those are things maybe we can bring up and work with our state legislators to help fix as well.
All right, thank you.
Thank you. Thank you. With that, we're adjourned.